We're going to start back in about 5 seconds, sir. I'm going to give you a quick count.
Welcome back. We're going to turn it over now to our manager, Scott, for explanation.
Thank you, Mr. Chairman. We're going to go back and start the approval of the agenda over, and we had suggested we move up the items are under items for discussion. The resolution requesting all business be allowed to open in the state of North Carolina. In the second item, the proposal for wearing of face coverings. Both those items would be moved up to precede the items report by our public health director and Dr. Waldron from Vidant Health. And I believe the clerk is going to call the names from the beginning, starting with our chairman.
Chairman McGawhorn,
Yes.
Vice Chairman Colson,
Yes.
Commissioner Albright,
Yes.
Commissioner Fitzpatrick,
Yes.
Commissioner Floyd Huggins,
Can you hear me?
yes, ma'am.
Okay, I raised my hand earlier because, and that's what I was trying to do before, was to make a statement about one of the items that you're moving. So I don't know whether I'm in order now to do that, or should we continue through this and then let me make a motion later? What I want to do is to remove the item from the agenda of discussion of the resolution to reopen North Carolina. We've spent a lot of time on this previously at 2 other meetings, and so that was why I raised my hand at the beginning before, but you couldn't hear me or whatever. So that was my so I don't know. Tell me, am I in order or just what?
Madam County Attorney, would a substitute motion be in order now, or can we do that since they're voting?
So typically, under parliamentary procedure, once you've had a motion and second and you've begun your vote, you don't stop that process. I'd recommend to you, because of the technical difficulties that surrounded the electronic meeting and the inability to communicate at the beginning of the meeting, that ultimately it's a decision for the chair, but we lacked the opportunity for discussion after the motion and the second. And so my inclination and recommendation to the chair would be that you allow a period of discussion prior to your vote. I think on balance, there's no harm in doing so. And I think the laws that allow remote participation expect us to assure that everybody has a meaningful opportunity to participate in the meeting. And so my recommendation to the chair would be that you halt voting at this point, that you allow for a period of discussion and on the motion, and then you proceed to vote through.
Very good. Thank you, Madam Attorney. To get back to your question, Commissioner Huggins, at this time we'll open for discussion on the motion. Commissioner Huggins.
Oh, thank you, Mr. Chairman. And good morning to fellow commissioners. I'm sorry for the difficulties. I don't know what went wrong, but I'm always respectful of difference of opinion of my fellow commissioners. But I feel that we have so many other things that we can be talking about that we have an effect upon. So, and to spend more time on discussion to send a resolution to the governor to reopen the state of North Carolina when we have an increase of death, increase of cases across the state. And I feel that we should, and we've talked about this 2 times before, that we should let the governor work through his phases. He's not pulling these phases out of the air. He's meeting with people that his phases affect. And I feel that this is just useless time spent again this morning, even discussing this now. It's time that we can be used to talk about the many things that we can have an impact on for the citizens of Pitt County. This resolution is not going to change the governor's plan. So I don't see the need to continue to, as the old saying said, beat this dead horse. So that was why I want to offer a motion to remove it from the agenda.
So that would be a substitute motion.
Okay, do we have a second on that substitute motion? Commissioner Nunley?
Well, I actually wanted to pose the question, maybe, and I don't want to direct it to a particular commissioner, but if this essentially is a resolution for local control yet again, I would caution us going down this road unless there's some new, some big change. I'm not inclined to squelch the discussion, but am I correct in reading this and that it essentially boils down to another request to the governor for local control over a state-run response? And if that's the case, I'll either, I guess maybe someone can answer that question for me.
Mr. Chairman, Commissioner White has her hand up. I think since she had.
Okay, Commissioner. And then the question was asked for clarification from Commissioner.
Nunley, yes, I think she can probably address. If not, I'll be happy to.
Okay,
I'd like to give her a chance first.
Commissioner White.
Yes, thank you, Chair. This is not another resolution for local control. It states up there that it is a resolution to request the governor to allow all businesses to reopen in North Carolina. This is not another resolution for local control. I would like to point out that he has opened many businesses under phase 2, and there's some things that I can't logically understand, and a lot of people can't logically understand. For example, he has allowed pools to reopen. So you can sit in a pool 6 feet away from somebody, but you can't go to a gym and work out on a treadmill 6 feet away from somebody. That's what this is about, just fairness to all businesses all across North Carolina being allowed to open under the same guidelines and recommendations. This is not about local control. This is not saying, hey, let Pitt County decide what we're going to do and what we're not going to do. This is basically saying that all businesses should have a fair chance to open and make a living under the same guidelines. And this would be requesting it statewide. So no, it is not the same thing that we have discussed before.
Okay, very good. Commissioner Huggins.
It may not say that we're asking for Pitt County, but it amounts to the same thing. It's an opportunity to ask for reopening of all North Carolina, the whole state. As I said before, when we have an increase of cases and deaths across the state of North Carolina, and why send this to the governor? It's not going to change anything. You know, he's not going to change his plan. So I see that we should just work through the phases that he's putting forth and go from there. So again, we're spending a lot of time on something that we cannot change.
Hey, Commissioner Ward.
We would need a second to the substitute motion in order to discuss it.
Okay, do we have a second to the substitute motion? Commissioner Ward.
I wanted to second that motion. I'm sorry, I'm having difficulty getting in. Were not able to get my whole screen up. Anyway, I would like to second that motion that we do not consider this.
Very good. Commissioner White again?
Well, it's already been seconded, but again, I was just going to say that it is not about local control. It's about allowing all businesses to open because there are a lot of business owners that don't understand why certain businesses can be open and why they can't be. Again, it's not about local control. It's a completely different issue, but it's already been seconded, so.
Very good. Madam Clerk, at this time, should we call the roll again for the, how will we do it?
Yes, if there's no further discussion, you'll vote on the substitute motion first.
Okay. We're voting on the substitute motion first, made by Commissioner Huggins. Okay,
So the motion was motion to approve the agenda with removing the item for discussion, resolution requesting all businesses be allowed to reopen in the state of North Carolina, and moving the items for discussion wearing of face coverings to items of report. Chairman McGawhorn,
no.
Vice Chairman
What?
Colson,
No.
Well, now,
I'm sorry.
I want to understand, I'm voting that we do not entertain that resolution.
So the substitute motion is to take it off from discussion. So if you want the item to come off, you vote yes. If
Yes.
you want the item to stay on, you vote no.
Okay, let's start again.
Okay.
Chairman McGawhorn,
Yes.
Vice Chairman Colson,
No.
Commissioner Albright,
No.
Commissioner Fitzpatrick,
No.
Commissioner Floyd Huggins,
Yes,
Commissioner Nunley,
Yes.
Commissioner Ward,
Yes.
Commissioner White,
No.
Commissioner Perkins Williams,
Yes.
motion passes. Motion passes.
Okay. At this time, we start with the presentation. And Brian Barnett and Scott Elliott.
Thank you, Mr. Chairman. Well, this morning we have several topics on the agenda of importance, and the first one is to hear a presentation regarding the proposed budget for the new fiscal year beginning July 1 for the year 2020 and 21. Before you should have had delivered Friday the PowerPoint presentation that we're going to show on the monitor this morning, as well as the binder document that is the corresponding documents that you can see in greater detail as to what I'll be putting up on the monitor or on the screen. You also have in the binder the PowerPoint presentations of most of the agencies that will be presenting tomorrow, Wednesday, and Thursday. I believe the Sheriff's Office will be delivering theirs later today, and we'll get that distributed to the board, emailed or hand delivered. We really pared down the presentation from years past and tried to get to the nuts and bolts of it. And I'm going to run through this with you real quick. So on the first slide here are your priorities. We reviewed these back in the CIP workshop back early the first of the year. These are what you affirmed, and these categorical blocks of functional areas or priorities or things that we use to try to develop the proposed budget for the new year. Next slide, in terms of, we wanted to acknowledge some COVID-19 impacts, some coronavirus things that have affected the development of the budget and how we see ourselves moving forward. We've had a decrease in sales tax revenues of about 5.5%. And it actually would be greater than that, but we'd actually had, to the credit of our finance director, we had underestimated our sales tax revenues in the prior year, which actually helped us going into a new year as such. Our interest earnings are going to be down almost 71%. We currently have about $1 million in investment earnings budgeted in the current year, which we will meet that in the current year. But in the new year with rates, the majority of all that will have to be taken off the books. We are lowering the property tax collection rate, the percent collected that we collect on in terms of ad valorem taxes, to 98.5. Statutorily, we could use 99.4, which is the rate that we ended June 30th of the prior year, but felt like in the current environment, we needed to reduce that. This budget also eliminates a COLA, a cost of living adjustment provision for our workforce. We would normally use a 2.5%, which is a January to January index we use on the federal level. This budget eliminates the far majority of all position expansion requests. This budget defers most all of the capital requests and needs. It also eliminates or defers several fee increase requests. On the next slide, in terms of guiding principles, obviously we try to evaluate the requests against the board's goals or priorities. We obviously, as local government, are not privy to state and federal, where they don't necessarily have to have their revenues meeting their expenditures, but we do have to deliver a balanced budget and do have to live within our means per se. We continue to use the fund balance plug of $3 million of savings or fund balance, but then through those items, through lap salaries and whatnot, this plug falls back in terms of back into your fund balance. And this budget continues with our base budgeting concept. In terms of revenue drivers, we have, in terms of the tax rate, we have adjusted it to a revenue neutral rate based upon the 2020 revaluation reappraisal. The current rate today is 72.1 cents. So on a $100,000 house, your Pitt County tax bill would be $721. We're recommending the revenue neutral rate, bringing it down to 67.97 cents, a little over 4 pennies of a rate reduction. This again continues the fund balance appropriation. On the next slide, in terms of our drivers, expenditure drivers, we continue to have the mandated increases by the North Carolina State Treasurer for the ledgers, which is the local government employees retirement system, and to meet the obligations of Pitt County as well as all counties and units of local government into that system. We have the mandated costs for the Raise the Age initiative, where 16 and 17-year-olds juvenile detention mandates or detainees are taken out of juvenile detention, actually taken out of detention center as such. This budget, in terms of unmandated, some expenditure drivers we have is additional funding for Pitt County Schools, Pitt Community College. This budget does two things in terms of pay for performance for our workforce and the certification pay that whether employees and sheriff or inspection should receive. We have budgeted the merit or the pay for performance, but it is being recommended to wait until mid-calendar year, the end of December, to see how our revenues flow. And if things are tracking, then we would be recommended then to put that into place, make it retroactive back to July 1. The same thing with the certification pay increases. We'd handle that the same way. If things are not tracking, we would then probably would recommend a hard freeze for the entire year on those type of expenses. On the next slide, in terms of the recommended budget for all funds, and obviously the budget is made up of a number of different funds, your primary fund being your general fund, but the overall budget is being projected increase of 3.27%. The adopted budget we're currently in has a $251,385,900 expenses included in it. Recommended budget is $259,606,650. On the next slide, the general fund, which is a fund within all funds. It's the primary fund that dictates and drives the property tax rate that is needed to fund the general fund as being the primary revenue source that pays for general fund expenses, is proposed at $182,259,640. Again, the rate, as previously stated, 67.97 cents would be the proposed rate to balance the budget. Current rate, the 72.1. So the adjustment is about 4.13 cents. On the next slide, in terms of the general fund, we had a little over $194 million in total requests for expenses. We reduced that by $12,049,714. Took a lot of meeting with the department heads, and would credit the finance department and their Brian and Kelly and Denise in the work to bring this budget down to the proposed $182,259,640. In terms of the revenues projected, again, $3 million fund balance plug, the tax rate is stated, and then you can see the difference between the percent difference growth is 2.23%. And part of this is the retirement system increases, the fact that in the current year, we did a cost of living mid-year, 6 months into the year, beginning July 1. We had to make that 6 months up out the gate, starting in the new year for the 2021 budget. So we had a few things that were mostly uncontrollable that pretty much dictated the small percentage increase there. On the next slide for revenue review, provide you a pie chart and a breakout of your revenues. Ad valorem taxes being your highest revenue source at over 50%, other taxes almost 12, intergovernmental 15, and then so on and so forth down the list you can see there. On the next slide actually gives you the dollar amounts for all of those revenue sources, totaling the $259,606,650. Next slide, again, the recommended rate of 67.97 cents. In terms of your tax base of all the taxable property in Pitt County, currently we have $13,047,967,948 of taxable property. Through the revaluation project that our tax office, tax administration has conducted, we've seen about 11.58% overall growth in taxable property in Pitt County. The new base is estimated at $14.6 billion rounded. That's an increase in the base of $1,510,586,714. That would be the increase that we've seen over the past 4 years since the last time we did reappraisal or revaluation back in 2016. On the next slide, in terms of sales tax, the adopted budget, we have $20,293,822. We're recommending a decrease in that to $19,237,062, 5.49%. And again, that would have probably been, or not probably, it would have been even a greater percent decrease if we hadn't been as conservative in the current year as we had been on sales tax revenue projection. Next slide on proposed fee changes. This was covered at the last meeting on May the 4th. These are all deal strictly with solid waste in terms of what is being recommended. And we will have a presentation again from solid waste this week during their time slot on the agenda. But these are the things that were covered on the 4th. The residential waste fee on the annual bill that goes to the households is proposed to go from $6.17 per month to $10 per month. Commercial tipping fees up $2. Construction demolition tipping fees up $2. Clean wood and pallets up $1. Concrete blocks $1, and shingles $1. I want to remind you the solid waste and recycling is an enterprise fund, operates basically as a business. So at the end of the day, it has to, the revenues have to meet its expenditures and cover its costs. We do not transfer funds from the general fund into this enterprise fund. And that's part of the rationale for the fee increases. On the next slide, in terms of fund balance, just to remind the board, the fund balance is basically your savings account. It assists us in cash flow. And in terms of cash flow, normally the tax bills go out in the month of July. Taxes, if you take that opportunity to pay in August, you can get the discount rate on that. Otherwise, then taxes are due in January of the following year. So we still have cash flow for debt service, payroll, and so forth. So we need to have adequate fund balance to pay bills while the taxes are coming in per se. Also, we need fund balance for one-time costs such as responding to hurricanes and as such, purchasing capital equipment as we go along. And even as important as that, the fund balance is evaluated every time we borrow money by the bond rating agencies in New York in terms of our credit worthiness. And depending upon our credit worthiness, and we are double A rated, that then affects the interest rate we pay on that money as we borrow that money over a 20 or 25-year period of time. Right now, we do have a strong bond rating, probably about the best you can get for the size of Pitt County government and the size of our budget, that being the double A. The best is the AAA, and that's more reserved for Mecklenburg County, Wake County, Guilford County, the larger counties in the state. You're on the next slide. In terms of fund balance, your goal is to your adopted goal as a board is to have to maintain an unassigned fund balance in the 18 to 20% range. Our peer counties actually have probably on the average of 30% of fund balance. And the board policy, I'll read it here, says the county shall respect the integrity of the fund balance by utilizing it as sparingly as possible when funding future budgets. So the next slide we show, this is kind of a detailed slide on the monitor, but the last column is probably the most important. We're estimating what we anticipate fund balance to be for June 30th of the year that we're ending. And obviously we're ending this year with some effects of COVID-19 affecting sales tax. We've seen a little bit of that. I think we've got the March numbers in. I think, did we get the April's numbers in, Brian? We're waiting on April, May, and June, which is your last quarter of the year. They're always 2 months behind when we receive the date on this. So we're projecting a June 30th fund balance percentage of 17.68%, just under 18%. It is footnoted on the bottom that once we do a borrowing for the Pitt County Schools next capital project for projects, that we will reimburse ourselves for the Warren Farm purchase was about $3.8 million out of our fund balance. And when that money comes back into your general fund, your fund balance will be 20.09%. So you're right there back on top, or almost slightly on top of the range of 18 to 20%. So fiscally, if we land where our finance director is projecting, we should be in good shape and maintain that range. Your next slide is basically just a chart showing through time. You can there see that going back to 2013, we chart that through 2020. You can see the in the red is the minimum policy of the 18% flat floor we have on that. The green is the peer counties. You can see there's a little under 30%. Pitt County is in the blue. And that's all I have on that one. All right, on the next slide, expenditures. In terms of review of it, on the next slide, you have the pie chart and the corresponding percentage of all categories. This year, we would continue to have education as your #1 expenditure category, which then corresponds to your #1 priority as you've affirmed year over year. We have flipped the next two. Normally, human services would be your #2 and public safety your #3. But public safety actually has become your #2 expenditure category from a percent standpoint. Then the others you can see is listed. Next slide is then the corresponding dollars associated with each of those categories. Education at $62,296,290 of your total budget. Okay, moving on. Speaking of education, we're going to go into an education funding review. First, we'll look at Pitt County Schools in terms of their budget request. The first column on the left shows the county's current expense appropriation. That top line, $40,565,920. School system had requested $42,408,174. And it's recommended a total of $41,157,811. That's an increase of $591,891. And this is basically to cover their retirement increases and was it Social Security? Two minimal things in their budget. The school system is privy to the privy or privileged is probably more the better word, privileged in terms of they are receiving $8 million in COVID-19 funds, CARES Act funds from the federal government that they can use to some degree to prop up some portions of their budget. So that represents a 1.46% increase in appropriations to the Pitt County school system. We'll continue to budget and recommend the Capital 1, 2, and 3 at $1 million, the rent agreement for space in this building at $340,000. So the total amount going to Pitt County Schools is proposed at $42,497,811. On your next slide, for Pitt Community College, basically just getting down to the bottom here, there's a 2.91% increase representing $174,173. We were able to actually meet 100% of their request. And obviously, even though their percentage is about twice that of Pitt County Schools, the dollar amount is about a third of what is going to Pitt County Schools in new dollars. On the next slide, in terms of total education funding for both Pitt County Schools and Pitt Community College, this breaks out between the current expense, the Capital 1, 2, and 3, rent, the capital reserve, Article 46 sales tax, school improvements, everything that we spend money on for education, that's $62 million, almost $62.3 million of expense here in Pitt County. On the next slide, for the Pitt County Industrial Development Commission, right now there's a current 1 cent tax rate for the Development Commission. It's being recommended to adjust that based upon a revenue neutral adjustment factor. In order to bring in the same amount of money that they currently are bringing in, it would then go down to 0.94 cents. On the EMS District Fund, again, this was an area that we focused back on May the 4th, and the recommendation by the EMS Oversight Committee was actually for a 6.2 cent EMS tax. The EMS tax is a district tax that serves the 8 nonprofit squads of the county, as well as the county's 2 Pitt County operated squads. This would adjust the rate. My recommendation is to adjust it from the current 4.6 cent rate to 5.95 cents, a little less than what the EMS Oversight Committee had recommended. This will continue, even though somewhat on a limited basis. The capital replacement plan, I think we cut those dollars in half in terms of bringing the rate down from 6.2 to 5.95 cents. On the next slide, basically this gives the breakout of the revenues from the system, from the taxes, delinquent taxes, transport revenue, Medicaid settlement, miscellaneous, and then fund balance appropriated, showing the current year, new year, and then breaking it out to the $6.6 million overall total. One thing you will note is our transports are down about $200,000. We are seeing transport revenue ability to collect declining a little bit, and maybe something we want to bring back before the board and discuss some more aggressive collection techniques like we use on ad valorem taxes. We have not employed those techniques necessarily as much on EMS revenues, but maybe something that we need to look at as we move forward. On your next slide, in terms of expenditures, again, the EMS district tax is a tax that includes all of Pitt County except for the city of Greenville. Back in 2002, 2003, the city of Greenville opted not to be part of the overall county EMS district tax. So you see the 8 nonprofit squads that operate our system, as well as the 2 county operated county squads, as the expenses are outlined on this chart. We are basically not increasing for the nonprofit squads. They, for the most part, they remain at the same appropriation that they have in the current year. Next slide, in terms of fire district fund, just like the EMS district, we have 20, well, EMS district, there's only one, but with the fire districts, you have 20 different fire districts that cover basically the unincorporated portions of the county. And of those, you have 3 of them who are asking for a tax increase. Again, this was the 3rd item we brought to you back on May the 4th to focus on in terms of the rate they're asking for. Blackjack going from 7.9 to 8.9 cents. Red Oak from 7 to 9.5 cents, a 2.5 cent increase, and Simpson from 6.5 to 6.65. On the next slide, in terms of your affiliate agency funding requests, and affiliate agencies we've considered, you can contrast those to sustaining agencies. Affiliate agencies are basically agencies we said that if they went out of business, more likely we would have to take them over and provide that service. On these requests, we've held these flat. They're getting the exact same amount of money they are receiving in the current year from 1920. The total of all these is $915,836. Each of them did ask for additional monies, at least the first two, the library and the Council on Aging. Sustaining agencies, excuse me. In terms of all of the appropriations being recommended, these are being held flat, no increases on each of these. Community Crossroads Center, which is the homeless shelter, drug treatment court, the Greenville Public Access Television, Little Willie Center, and moving on. Then the libraries, all of those are remaining flat as well. Then moving on, recreation and civic arts, all of these are remaining flat. We did have a new request from the North Carolina Museum of Natural Science at Greenville. This is basically a time for life. They have now been recognized by the state of North Carolina to be the North Carolina Museum of Natural Science here in Greenville, both in the downtown, Uptown location, as well as the Time for Science down at Kittenia Creek. They did ask for $50,000, but since this budget is not really dealing with any expansion, some contraction, but no expansion or holding the line per se, that no new funding was recommended for that entity. All right, in terms of human resources, we had 32 new position requests, which I think was about 1.1 million or greater in value in terms of what those would have costed. We basically whittled that down to 2 based upon the first one in public health that would actually be 100% Medicaid funded. It made sense to recommend that. Then within DSS, they had one position out of, Brian, do you remember their total? We'll hear from them, but 1 out of 20 that we recommend to fund. It's 55% state, federal and state funded, 45% county. They moved into a facility that we asked Trillium to vacate out at the north of the river office park. It was one of the old Earth group home buildings that had been converted into office space. Trillium was housed in there, and we asked them to leave so DSS could expand into there. And when DSS expanded into that space, they have no one at the front to direct traffic, answer calls, and basically act as the point person at the front of that building. So those are the 32 positions, the 2 that are in the recommended budget at this point. On the next slide, in terms of calculation rates, that first one, retirement, where we're showing that being one of the budget drivers, the state treasurer is driving on the local government retirement system. The rates, we've gone from 9% to 10.2% contribution. And then you can see the same thing for law enforcement, 9.7 to 10.84. The 401k, that is something that the county offers. You can actually see that's dropped a little bit on the general government. Law enforcement has remained flat at 5%. Your next slide for our ongoing classification study. I believe we've done 15 years, 5 3-year cycles. We're actually in our 16th year, maybe somewhere thereabouts. Well, the slide does say 15th year, fifth rotation cycle of this 3-year ongoing system, where every year we look at 1/3 of the positions within the organization, so that every 3 years we've gone through 100% of all the positions to look at their pay as we compare them to other like entities outside of Pitt County government. And we are not comparing, again, I'll repeat that, we are not comparing current salaries. We are comparing the beginning salaries as we compete with other entities for positions to make sure that the starting salaries, that base salary is competitive with these other jurisdictions. In terms of the classification we're doing this time, which was administrative professional, which is, I guess, would be the top 1/3. We had one recommendation, and that was for a downgrade from a 69 to a grade 68, as you can see reflected on the screen. On the next slide, in terms of our employee medical insurance fund, it really seems odd in my 19th year of doing the budget. It seems like when the general economy is doing really well and the general fund is doing really well, the health fund is an issue. But when the economy and the general fund is struggling, then the health fund is doing better. And that's the case we have this year. We have no recommended changes to our self-insured employee medical insurance fund. Based upon that, everything will remain, no premium changes, no employee participation fee and changes, and no changes to the dental vision reimbursement plan. In terms of the capital improvement plan, the recommended projects on the next screen, you'll see our annual vehicle replacement plan, the facilities, capital maintenance, and some of these that have been cut, even as they're shown here on the screen. Security improvements, 50,000. The EMS, corresponding back to the EMS district tax. Detention center generators. This is one the sheriff came and presented a while back, seeking some federal dollars on these, and also looking at some peak shaving energy saving consumptions that would pay for some debt service on this. Detention center facility improvements. Then human services, there's a software program for DSS and migration from Northwoods to a program called Traverse Software. And then with education, the recurring $1 million we give to PCC, to Pitt County Schools, and the 100,000 to PCC. And it also within the solid waste recycling department, we have some equipment that would be purchased within that fund. Some rubber tire loader, roll-off truck, yard jockey, rubber tire excavator, as well as then some repairs to our various sites of our 14 convenience sites we have throughout Pitt County. So you have a total recommended $4,940,400 of that. In terms of deferred projects of CIP, and again, this is a staff recommendation, but several things we talked about back in January in the CIP workshop was spending $100,000 to see what value there would be in renovating this building versus replacing the building. We're deferring that. That was taken out of the budget. We've deferred $200,000 in costs of our phone system here in the throughout the county. Again, to hopefully to another year when things are better. In terms of Uptown departmental relocation, we had $2,000 in their budget. We'd like to defer that. There were some within public safety for animal services, replacement of dog kennels, $106,942. We're recommending to defer. The Sheriff's Office Administration Building, I've talked to the sheriff on this. Well, it's actually a $5 million project. We had gone to had actually issued an RFQ, which is a request for qualifications. We went through all the proposals that came back in for an architectural firm to be vetted, to be selected to design that project. We actually interviewed 3 or 4 firms, and we're getting ready to come and make a recommendation to you. And we were going to put $250,000 in next year's budget to pay for those costs for programming and design, and then the bidding of that facility. But with the economy the way it is, the COVID effect the way it is on the budget, we thought it would be good just to defer that at this point in time. If you decide you want to pursue that, you can do that. Basically on that, you'd be taking that $250,000 out of fund balance. You would be adopting a reimbursement resolution. So at some point, if you were to bid that out and then borrow the money, you would then reimburse yourself that $250 back to your fund balance. That project is being paid for. The $5 million on a probably a 20-year note is being paid for by the freed up capacity from the Pitt County Courthouse expansion project. We're just paying off now from 20 years ago. So again, that would be one that you as a board could decide if you want to just hold and see what my recommendation is. Hold the first maybe 2 quarters of the new year through the mid-year calendar year to see what the economy does. Detention center air handling units was another item that we had recommended to defer at this time. Then the last one was some permitting software for inspections. Also, 2 other projects. Within public health, they had a medical records office renovation. Before going on to the Epic system, the public health actually literally had a medical records area with the compact rolling cabinets that had all the medical records stored there. Those have now all been digitized or electronically converted, and they participate with the Epic system. So they were wanting to renovate that space for office space. We've deferred that project. Then the last one, the proposed gymnasium for Alice F. Keene. We talked back in the budget workshops of appropriating $250,000 to go ahead and possibly hire an architect, design that facility, in hopes of then of landing some type of grant dollars to construct it. Again, the way the economy is right now and the unknowns of our revenues, it's being recommended to defer that until things are better known. All right, on the next slide, in terms of what we call a look forward, a couple things in terms of we want to acknowledge as unfunded needs. One is what we've been talking with members of the General Assembly about the pretrial services program that Judge Blunt has proposed, as well as the behavioral health court treatment program that Judge Hazelton has proposed. Those are not funded in this budget. Again, that would be expansion. We have pretty much deferred or eliminated, you saw the 32 position requests, only 2 of those are recommended. Also, other funding requests and capital requests have been deferred or eliminated in this budget. So on the next slide, your remaining budget calendar beginning tomorrow from 8 to 12 here in the auditorium, this auditorium, you members will have the option to participate via Zoom or to attend here in the boardroom. You'll have the different departments coming forward beginning tomorrow through Thursday to present their formal requests. And then we have next week open for additional workshops if that would be needed. Right now, we have a public hearing scheduled for Tuesday, June the 16th at 7 p.m. And keep in mind that if anybody is participating via Zoom and you wanted to adopt the budget, we have to wait 24 hours, at least 24 hours after the public hearing is concluded before you can adopt that due to the new laws put in by the General Assembly of North Carolina. So we would have to wait at least a day after that. We do have an alternate date for adopting the budget, that being June 23rd at 7 p.m. in case you needed to push that date out for some reason. Mr. Chairman, that is all I have. And if there's any questions, I'd be happy to take those. If there's anything we can't answer, we will try to bring that back to you tomorrow. And normally what we do is after each presentation, whether mine today or then beginning tomorrow, as you have questions, we then try to get those answers to you the next morning, answer those first, and then move on with the departmental presentations that would correspond. So,
very good. Thank you, Scott. You've heard the presentation. It was for information only. We're going to begin to the meat of this starting tomorrow. But do anyone have any burning questions they would like to ask at this time? I hear none. We'll move forward. Public address to the board, Scott.
Yes, Mr. Chairman, we have one person who has submitted a written comment via email, and we have one person holding via Zoom. There'll be an audio comment. And if you would like, I can read the email we received.
Yes, sir.
This is from Mary Elaine Yance, and the subject matter is reopening and face coverings, and the message is very simple and just one sentence. It says, please allow science, data, and guidance of health professionals to take priority in decisions regarding reopening and face coverings. Signed, Mary Elaine Yance, 1043 East Rock Springs Road. Then we have on the Zoom online per se, Mr. Don Cavallini, if our PO office can pull him up. And if County Attorney can read our comments about public addresses.
Yes, Pitt County welcomes comments on all matters of public concern. Prior to speaking, please state your name and address, and I'll keep your time at 3 minutes per speaker.
Okay, Mr. Cavallino.
Looks like he's left his, I don't see him on the video.
Okay.
We want to come back to him?
Yeah, we'll come back to
Still
him.
muted.
Yeah, he's muted too, yeah. He's probably self-muted.
Okay.
I see his video.
Yeah, I see a video, but I don't
I
see
think
him
I
in
think he
the
left.
picture.
Oh,
Well, if he comes back, we'll entertain that at that time. We'll move forward.
All right.
Public Health Director, COVID-19 discussion, Dr. John Silvernail.
Morning, Mr. Chairman,
Morning.
other commissioners, fellow department heads. Want to give you a brief update on where we stand with COVID-19 this morning. Today, we are 5 incubation cycles in 4 days, so 10 weeks and 4 days since the first case of COVID-19 was identified in Pitt County. Cases continue to accumulate, but estimated recoveries also continue to grow. Pitt County Health Department, as you know, we are struggling ourselves with an internal exposure. Last week, we had an exposure from an asymptomatic staff member. Her retest is pending. We had some questions about the validity of her test, given some date discrepancies on the test results. So we've had her retested. The staff member did work in clinic on May 26th. We were notified of her positive test results on the 28th. We were unaware that she had been tested prior to the 28th. All of our exposed staff have been sent home to self-quarantine, and testing of exposed staff was arranged for this morning. And I was speaking with my director of nursing on the way in this morning, and that had been completed or was in the process of being completed this morning. You may ask why today and not last week. The current guidance is to wait 6 days after exposure to test people. If you test too soon, there's a chance of getting a false negative by testing too soon. So we wanted to follow that guidance. 6 patients were seen by the staff member. All of those patients were notified by our communicable disease staff and offered testing. Some of those exposures were very brief and very low risk. A written press release and an in-person media availability were provided last Thursday afternoon by myself to address this directly with local media for the community. Our clinical services remain in operation with remaining staff, but we are on a skeleton crew at the moment until we can get our staff cleared and back in the office. In spite of this, our staff morale remains good. Earlier in this pandemic, my staff was fearful like everybody else, but they have put a brave face on and they come in and they do their work and really seem to be in pretty good morale right now. So I'm pleased with that. Wanted to review the racial and economic disparities of COVID-19 with you briefly this morning, and let me tell you, it pains me to share this data with you, but I will share this data with you this morning. Earlier in the epidemic, we looked at a sample of 84 cases. That was on April 17th. And at that time, we found that 47.6% of those cases were among Black non-Hispanic individuals. Black females accounted for 26.2% of cases at that point in time. Black males accounted for 21.4% of cases at that time. Last Friday, I began re-examining our Pitt County data. As of last Friday morning, we had 279 cases. 154 of those cases are among Black individuals, or 55.2% of total cases. 95 Black females account for 34.1% of our total cases in Pitt County. 59 Black male cases account for 21.1% of total cases in Pitt County. In the earlier analysis, we did not have anyone identified as of Hispanic ethnicity. In this second review from May 29th, I found that there were 38 cases that identified as white/Hispanic, or 13.6% of total cases. Broken down by sex, 25 female cases accounted for 9% of the total caseload. 13 male cases accounted for 4.6% of the total caseload. Whites, white, non-Hispanic, and the few unknowns in our database account for about 1/3 of it, or 31.2% of total cases. Again, as of May 29th, which is last Friday. Our Pitt County COVID-19 cumulative data. This is our cases by day of specimen collection. You can see we had a range expanded to 13 on May 19th. We had our biggest day, May 20th, the biggest day of cases. Again, they've come down over the weekend. We received 6 cases as of this morning, which is not shown on the graph. So about 3 per day over the weekend since we left the office on Friday. This is our cumulative case curve. As of this weekend, when we put this together, we were at 283 cases. As of this morning, we're at 289. We had 6 cases over the weekend that came in, so averaging about 3 per day over the weekend. This is a new graph. It's the first time we're showing this graph. This shows our cumulative recovery, estimated recovery by date of analysis, not by case date. So as of Friday, we had 208 estimated recoveries in Pitt County. My intention is to run that Monday, Wednesdays, and Fridays and report that recovered number. It's become a rather lengthy process as our spreadsheet, as our database has grown, to go back through and review that and derive this recovered number has become quite an onerous manual process. And I'm the person who does that. So I've kind of had to cut back just from time demands to 3 days a week. This is our percentage of positivity, and where you see we had gotten down to 7% and then we started to creep up. That's about the time that we had difficulties obtaining our negative laboratory reports. The change restructured how they were receiving data from testing providers, and that affected how we received negative results. So our negative results don't come to us directly anymore. They are flowing to the state. They're being closed in the state system, and then we're having trouble extricating them from the state system, recovering those from the state system. So we estimate that for beginning on about that day, it was the Sunday before Labor Day, or before Memorial Day weekend, excuse me, that change was made. And so now we are somewhere in excess of 1,400 negatives behind in our data reporting. So we show the numbers based on the data that we have in hand. If I were to add those in and recalculate it, my guess is that that number is still somewhere between 6 and 7, and that percentage of positivity has continued to sort of flatten out and edge down. Last week, I didn't show it in the tables here. We looked at the cumulative Walmart testing data, and in the Walmart testing data, which is not completely Pitt County residents, so I can't tell you that it's all Pitt County residents, but at the Walmart test site, we were running about a 3.7% positivity rate in the Greenville Walmart test site. This is the summary bar graph again. The total tests and negative tests are in question because we have had a change in how the state has done that reporting, so we're not getting all of those. We stand at a little bit north of 3,000 people tested that we can account for, 26 as negative tests. As of the time of this preparation, 283 positive tests, 208 estimated recovered, and still stable at 2 deaths in Pitt County. Wanted to briefly touch on our testing plan. This is pending implementation of the CARES funding and availability of the CARES funding. So once approved, Pitt County Health Department plans to stand up a community testing program. This will include 3 fixed sites. First, Greenville Housing Authority, and our estimated time frame is Monday through Friday from 9 to 4 o'clock. I would do military time, 1600. Same thing at Moywood, Monday through Friday, 9 a.m. to 4 p.m. Pitt County Health Department will have testing available on Tuesday evenings for the community to provide an after hours or after work hours opportunity. We're not sure the exact hours on that yet, probably starting at around 4:30 and running till 7 o'clock when our evening clinic closes on Tuesday. And then we'll have one rotating site that will cover the periphery and more rural areas of the county to ensure that testing is available to those individuals as well. Some of the unknowns right now, we will operate this site as long as funding remains available and the need persists. The unknowns to us at this time that make giving an exact number of folks that we can test difficult are some discussions I had with Mr. Williams from the Greenville Housing Authority last week. He's told me that he received a reach out from HUD directly, and that HUD is interested in establishing a HUD-funded testing site at the Greenville Housing Authority. If that were the case, we would take my crew and the funding we were going to support that with and move that to another location within the city or the county. But he is still waiting further details on that. So in the short term, our plan is to stay testing up at the Greenville Housing Authority. The other question here, the cost, the largest part of our cost in providing this program was using LabCorp for the test analysis itself. Initially, LabCorp told us it would cost us $100 per test. Again, in some discussions with my director of nursing last week, LabCorp has said maybe they can do better on that price, but we do not have a firm number on that price yet. But we expect that that price will go down a little bit for us in the meantime. And that is my comments, prepared comments for this morning. I thank you for your attention.
Thank you very much, Dr. Silvernail, for your fine presentation. And I think that you just outlined the need for to continue with testing, especially as it relates to the Black community. And I certainly acknowledge that fact. Do we have any questions or concerns with Dr. Silvernail before he leaves? Commissioner Huggins.
Thank you, Chairman. For Dr. Silvernail, thank you for outlining your plan for testing. My one question is, how do you plan to get the word out about these testing sites?
Once we have a go live date, we will do a written press release, and it'll either be covered in my Wednesday press availability, or we will do a separate press conference with the media to get that out. We'll also work with the sites to get some signage up in the sites to allow those folks to know that we're coming.
Okay, I think that's good, but that's not enough. I don't feel that's enough. I think you have to make some effort to reach out to community leaders and community organizations to let them know about the sites and encourage people to participate.
Okay.
Commissioner Floyd Huggins, we can work through the Ministerial Association. We can also work through the local chapter in NAACP and make sure that press release gets distributed among them. So folks want to know where these locations are and the hours and details of it. If there's any other groups you know if we could work with, you could suggest those, we'd be happy to work with them.
Happy to engage your suggestions and reach out to those.
All right, thank you.
You're welcome.
Commissioner Albright.
Yes, thank you, Dr. Silvernail, and especially for your testing plan. Could you just explain real quickly the process of getting this approved, and maybe touch on the timeline, best case scenario when we might go live with these, and when that might be happening?
Well, I guess that hinges on when the CARES funds are actually available to the county. We have not received the clear. I'm going to defer to Mr. Elliott on that.
Yeah, we believe our $3.1 million will be distributed this week by the state from the federal government, is what we were indicated last Friday. But
is that what we mean by approval?
Well, we need to submit our plan, and that's the last thing on your agenda today. Technically, we were first told that the plan had to be due today, June 1st. As of Friday, they moved that back now to June the 15th. That's one change, and another change we'll talk about. There's another change to it too that affects the plan, not in terms of testing, but actually frees money up for testing, but we'll talk later on about.
So, but we could submit before June 15th to speed this up?
You can submit today. I mean, our goal would be to go ahead, if you're in agreement to what we talked about in the last agenda item for the CARES Act funding, to go ahead and submit. And keep in mind, the plan can always be modified. They've told us there's flexibility in terms of how we spend the monies, or how our plan can be modified. And then
yeah, I guess what I'm trying to get at is if we can speed up the implementing of the new testing in some way, I would be greatly in favor of whatever steps we could do to get this this very excellent plan in place as soon as possible.
Dr. Silvernail, did you want to talk about in terms of who would be, we've kind of talked about who would be targeted, but would anybody on the street be eligible to be tested? Or are we trying to have it be people who have symptoms of COVID, or people who may be in a population group that are more susceptible to get it?
In an effort to identify as many cases as possible, we would test people with symptoms. We would also test the asymptomatic to look for those asymptomatic cases in the community as well.
And would we limit the number of times a person could be tested? Could they come once a week and be tested, or would?
I don't know that we've thought about that. We have not seen repeat testing at other sites. We've had a couple, if you look through our data, you could find people that have been retested. But we haven't seen folks just being tested recurrently on a week-to-week basis. So at this point, we have not addressed that in our plan.
Mr. Chairman, if I can just interject one more question. I know you have two of the commissioners with hands up, but Dr. Silvernail, can you tell us how much value is there just in this point in time testing in this method?
The test for the acute disease identifies active cases, both symptomatic and asymptomatic. So that's in the range of an incubation cycle for that person. There's no protective value to the test. So if I test an individual today and they're negative, if they have exposures, it doesn't prevent them from acquiring the test and acquiring the infection in the future. If they were to be tested and say, well, I'm negative and I'm going to stay away from other people, there may be some value in them, avoiding contact with people, knowing that they're not infected. But as they go about their life, as long as it circulates in the community, there's a risk for individuals to be exposed and contract the disease.
Thank you.
I think you acknowledge the fact that if anyone want to be tested, it can be tested.
Yes, sir.
And I think that's crucial. That's crucial for everyone to know. Commissioner Florida Huggins. I'm sorry, Commissioner Perkins-Williams first.
Thank you, Mr. Chairman. Dr. Silvernail, I noticed that the data for the North Carolina Health and Human Services dashboard for the coronavirus has been changed. Did they offer any reason as to why they changed it so that the everyday person will be able to read it? It's ample.
Good morning, Commissioner. I don't speak for the state. I know they switched to a different format, something called Tableau, I believe is the name of it, which they felt gave a better presentation of their data, of the state data. Part of that website is designed to be interactive. Sometimes when I go to the website, the map is interactive and sometimes it is not. I know the state has had issues with their data management and data reporting as well. One of the things when you look at public health surveillance is about the identification and collection of cases. In general, public health does not report negative cases. If you look at tuberculosis or chlamydia or any other disease of public health concern, we report cases. We don't report the number of negatives that we have. With COVID, as we've expanded testing, we've needed to look at that data in a new way, which means looking at the proportion of the testing that's actually positive as a gauge of how much activity there is in the community. And that's not something that we do with the other conditions of public health. So it has stymied the state as much as it's stymied us on the local end.
Okay, the reason I asked that question is because the first method they did of testing, you could easily determine, because there's so many people come to Pitt County to shop and do different other things, medical and that sort of thing. And you could easily look at the surrounding counties adjacent to Pitt County and get some idea as to what's happening there as it relates to COVID. That's why I was asking that question. And to be able to know the number of cases, I know it's not a true data, but it's as close as you can determine. So in order to look at that, you could get some idea as to what's happening around us, because we don't have a chicken plant. We don't have a prison as such. I think Aden is the closest for us, but that would help determine what's happening around us. And so the map was always interactive for me, but I like that list that you could easily go to county and be able to see the numbers per county without having to write them down or print them out. How much tracing are you doing or monitoring?
We are reaching out to every case that we identify. As I said last week, we have sometimes some trouble contacting the cases. We do as best we can in contact tracing. Sometimes people do not identify. The other thing that we struggle with in contact tracing is delay in receiving results. Sometimes when you get results that are 10 days old, it's hard for someone to remember who they had contact with 10 days ago to go back and look at those individuals. But we do reach out, try to evaluate those, try to evaluate the contacts. And where in the past we were not advised to test asymptomatic contacts, that is now the advice, and we do encourage them to be tested and have been doing more of that on a scheduled basis at the health department for those individuals we identify as close contacts.
Well, and I also know that here, some residents just don't want you to know that they're sick. And I'm aware of that, and they don't share that information but they talk in the community. So I do know that that was possible because there was a death prior to the one that we talked about in the case that I'm familiar with. So, but I'd like to, I don't know how you're going to encourage those people to give up their personal feeling as it relates to the fact that they're sick. And that happens. That's why I always wear a mask. But I was concerned about the tracing because that would tell you how it will blow up and if it will blow up in certain aspects of the county. That's what I was concerned about. I thank you so much for what you do. And I hope, you know, the negatives are fine. I think it's great as to what you're testing, but I'm interested in those people who have it and continue to spread it and the strong possibility of spreading it. And children don't think they can get it, but they can. And that was also involved in that, and I don't think you got told. But I know you have a very tiresome job and a very sensitive task, and I thank you for all you do.
You're welcome. Thank you, Commissioner.
I'm finished, Mr. Chairman.
Thank you very much. Commissioner Floyd Huggins.
Thank you, Mr. Chairman. Dr. Silvernail, Chairman McLaughlin reiterated the plan to the question, and you said yes, that anybody who want to be tested can be tested or would be able to get a test once we implement your plan. That is correct, right?
That is correct, ma'am.
Yeah. So I think that should be the beginning or up front at your press release, because I think if we have to get people thinking that they may have it and not know it. So if there's an opportunity to be tested to ensure that they don't have it, and that would help to stop the spread, and especially in my community. When I say my community, African American community, with the information that you presented, as you said, you really hate to present that information, but that information is fact, that we are affected with this virus more so than other people. So I want to ask you again about the tracing that the state is putting forth with hiring these people that will be coming into Pitt County to do tracing of cases. And I read again that the state is hiring 250 people to do this tracing, but this also should operate through the health department. But you previously said that, you know, you didn't have much information on that. And I would think that since it will be operating within your facility, that we would have a better handle, or you would have a better handle on what's going on with that effort. Do you have anything to add on that today?
Ma'am, that we are still waiting our turn. The state, as of last week, had hired, I think, about 150 contact tracers. They had hired the 10 regional supervisors. Their plan was to roll this out in phases based on the number of cases, the burden of disease in counties. So the larger areas of the state, Mecklenburg and the Triangle area were first up. We are in the second wave of that. When those people become available, they are hired by the state, paid by the state, but they are made available to the local health department as surge staff. And we will request those individuals and incorporate them into our communicable disease workflow.
Thank you.
Thank you very much.
You're welcome.
Commissioner Nunley.
Thank you, Mr. Chair. And Dr. Civil, now real quick, I'm sure that you're in constant contact with Dr. Lanker with regards to schools in the fall. Didn't know if you had any thoughts, or I'm sure you've thought about it, but about what we'll be doing about testing our teachers, if there will be regular testing of the teachers, seeing as how they'll be in, presumably if schools reopen, as I think a lot of people hope, they'll be in contact with multiple family units throughout the day. If there's been any conversation on that, and really just looking for an update, not really any concrete details because we're still a little ways off, but wanted to make sure we're looking forward on that.
Yes. Dr. Lanker and I do have a good working relationship on a first name basis. I think he's looking forward to getting through graduation this week. And we have not had any specific discussions about reopening. The idea of testing the teachers periodically may be very appropriate. And certainly that can be on the table as they would be markers potentially of infections in classrooms or in schools. So there may be a role for testing them with some regularity, and I'm happy to assist him with that.
Thank you.
You're welcome.
Okay, thank you very much for your presentation, and we appreciate that, and we're looking forward to more testing.
All right. Thank you, Mr. Chairman.
All right. We have Don Cavallini, I think, is back on. Don, can you hear us? Mr. Cavallini.
Looks like he's still muted either on our end or his end.
Can you unmute yourself?
So am I unmuted now?
Yes, we can hear you.
Okay, great. So first of all, thank you for allowing me to have this access under what are extremely challenging conditions, especially for those of us like Commissioner Ward and myself, who I'm assuming she's sharing the same difficulties as I am as a 76-year-old. But I'll do the best I can in addressing the board. And I appreciate that Chairman Melvin McGowan's deeply moving and concisely profound statement prior to the reading of the roll. Most importantly, I grieve with the rest of the nation for the loss of people like George Floyd, Ahmaud Arbery, and Breonna Taylor, and even more locally, Sean Rambert Jr., who lost his life at Cobblestone in July 9th of 2019 at the hands of a Greenville Police Department. And there were others close by that are also local. Not as recent, October 2018, Cedric Pritchard lost his life at the hands of Aaron Mobley in the city of Washington. But I did not initially plan to talk about that because I wanted to comment on the reopening, and I applaud Commissioner Huggins for her motion, and the rest of the council have voted in favor of it, because I think the reopening is a problem unless we do at least all three things that I think others have emphasized. One is abide, much like the state health officials and the governor, with his leadership, have said, go with the science and the data. Two, I think there needs to be a regional approach. And I think Commissioner Nunley and others have referred to this, Commissioner Perkins, that what is it if we make sure that we abide by the guidelines according to science and data, and other counties around us do something otherwise? I mean, after all, we're not going to put up checkpoints or roadblocks or anything. So this has to be a regional approach. And I think the measured approach by the county commission so far has been exactly what the county has needed. And I guess the third thing is that I understand, I watched the minutes of the May 4th meeting. I listened to the entreaties of businesses who are hurting and for whom many of our jobs depend, small businesses especially. And I think just that the most important thing is that we put people before profits. It's going to be very, very difficult to strike that balance. We're going to have to do that. And I know my time is probably up, but I want to say, because of what had happened last night, that after 2 days of peaceful protest, somehow something got in the way. And it was not the fault of the organizers. And I leave it at that. And I thank you so much for the opportunity.
Thank you very much for your comments. At this time, we'll move to Dr. Michael Waldron. As he commented, I wanted to just acknowledge the letter that he wrote to me, and certainly the rest of the commission, and received a copy of it. It was very profound, and it laid out some recommendation in terms of what we need to do to move forward. We're still having existing cases as he outlined, and we haven't really gotten to the point where we've arrived here. And I certainly want to tell you I appreciate that, and we listen to your concerns and acknowledge that we want to move according to what you're doing. Thank you.
Thank you. Appreciate it. Well, as I think about a lot of the things that are happening in our world, I'd like you to think about what we all, I think, all do daily and minutely, really, is to think about the people. I'd like you each to think about the people that are in your lives that you care about, that may have hypertension, diabetes, be over the age of 65, be overweight, and as we heard this morning, potentially be African American or people of color. And I think as you think about that, I think you should ask yourself the thing I ask myself really all the time, is how do we do simple things to save people's lives, especially now while we try to recover our economy? And that's what I'm here to talk to you about. I want to thank the commissioners for taking actions proactively over the past few months. And I know how difficult these discussions are, and taking the right actions to protect our communities. And these actions have had an impact and have done really incredible things. We've successfully flattened the curve for Eastern North Carolina, and that has saved lives for Pitt County residents. When you compare the impact of this virus in Pitt County at this time with the rest of the state, if we were like the rest of the state, the rest of North Carolina, we would have 13 more people that have died in Pitt County. And if we were like the rest of Eastern North Carolina, 29 county region that we serve, without Pitt County in it, we'd have 15 more deaths in Pitt County than we currently have. And as you've heard, the positive rate, despite the data issues for testing, we feel is pretty significantly lower in Pitt County compared to the rest of North Carolina and Eastern North Carolina. And I think as we all look at trying to recover and move into the future and recover our economies, it's that we need to stay focused on simple and prudent actions that allow us to do both, keep people safe and improve our economies. The successes that you have helped put in place have given us an opportunity as a healthcare delivery organization to build capacity to care for people and to make sure that it's safe and to have testing and other technologies in place to be able to make sure that we are able to serve Pitt County and the region. We have the data to show that Vidant has been highly safe as we care for Eastern North Carolina. And I'm really thankful for the consideration that you all are doing and plans on how to move forward to continue reopening our economy, but do so safely. And I appreciate the invitation to come speak to you today. I want to be clear that there's still risk and significant risk. Cases continue to increase in North Carolina, Eastern North Carolina, and Pitt County. And frankly, the risk probably for getting this infection is highest now than it's ever been throughout this whole ordeal. And I encourage everyone to stay home as much as possible, avoid large gatherings, wash hands often, practice social distancing, and wear a mask. And it's the last reason that I'm here to talk to you today. I strongly recommend that we follow the example of 37 other states and require the wearing of a mask. This supports our businesses as they open up, and the data and science is clear. It decreases the spread of the virus. That is not my opinion, that is fact. I propose that masks be worn when social distancing is not possible. A mask should be worn while in public spaces and in contact with others outside of the family household. When entering or exiting any business. For employees of private and public businesses and agency interacting with customers. I want to conclude by thanking you and the difficult decisions and the dialogue that you've had and for taking actions. And I feel that these actions have been very important in helping protect our healthcare workers, which are at the highest risk for contracting COVID-19. I want to thank all of our team members across the East providing life-saving care for not only those impacted by the virus, but for the many health conditions that Eastern North Carolinians face. And I want to reiterate the importance of prudent masking to protect that person that hopefully you had in your heart to think about as I started. With that, I'll conclude my remarks and happy to entertain any questions.
Thank you very much. Any questions? I see none. Again, I want to thank you for what you're doing. All right. Now we should move to the wearing of face masks. Ms. Nunley and you, Scott.
Yes, Mr. Chairman. So on page 30 of your agenda package, you have the agenda abstract that outlines Commissioner Nunley's request and the supporting material behind this. And I would ask you to, he's raised his hand, but turn over to Commissioner Nunley maybe to discuss his item he wants to present to the board.
Okay, Commissioner Nunley.
Thank you, Mr. Chair, and thank you, Manager Elliott. And so the conversation about reopening and getting our economy back up and running, and a lot of that conversation, I think necessarily, and thanks to Dr. Waldron for coming to speak about that today, revolves around cost-effective, low economic burden steps that we can all take to make sure that we continue to have a strong, that we have a strong economic recovery, not just in our region, but throughout the state and throughout the entire country. And so what's the big deal? And I guess, you know, I wear a face mask because I want to protect myself and protect the others. And also because I want to, you know, as an elected official, for someone to see this is the kind of thing that you should be doing. They're not 100% effective, but I wear a mask because it's mostly effective and part of respect for another person. There's no stigma attached to wearing a mask or stigma attached to staying 6 feet apart. It's about that obligation to others. You know, as a part of coming out of our lockdowns, the wearing of masks will be useful. You know, you keep your distance and you wear your mouth and nose protection, and then that just shows us respecting each other and allows us to continue to get back to work. You know, our entire country entered the war on this infectious disease, COVID-19, and you know, many leaders have apologized for not having sufficient masks at the initial onset of the disease, and I think that's provided a lot of confusion and some inconvenience to the public. I think it's important to know now that it's not necessarily what type of mask. It doesn't have to be a medical mask. It could be cloth. It could be other types of masks. But you know, I think when asked, countries that have gone through this, and what's the biggest mistake that developed nations have made in the response, and you know, leaders have indicated that in the United States and Europe in particular, in a lot of places, that people weren't wearing masks, didn't have a masking culture. This virus is transmitted by droplets in close contact. Droplets play that important role, and you've got to wear a mask because when you speak, there are always droplets coming out of your mouth. Many people are asymptomatic and pre-symptomatic. That's proven. And if we're wearing face masks, if they're wearing face masks, it prevents droplets and the disease from carrying and infecting others. And we know from recent studies, an overwhelming now number of studies, that a significant portion of individuals with coronavirus-like symptoms, they're asymptomatic or they're pre-symptomatic. So they haven't started to exhibit symptoms, and they can transmit this virus to others before showing symptoms. That means the virus can continue to spread with close proximity, speaking, coughing, sneezing, even if you're not exhibiting symptoms. So I could be sick in a room, and if I'm wearing a mask, I'm less likely to infect others. And that's just a fact. If I'm wearing a mask, I'm less likely to infect others, even if I don't know if I'm exhibiting symptoms. And in light of this new evidence, you know, organizations are recommending the wearing of face masks. When I say organizations, healthcare organizations, healthcare professionals, they're not governments. They can only make recommendations. Governments, we are elected to help make sure that our public is the most safe, and essentially in this moment of a worldwide pandemic, doing the best we can, not just for the health of our people, but also for the economic well-being of our people as we move forward. Because this, as I believe Commissioner Fitzpatrick mentioned in the last meeting, we've got to learn how to live with this virus, and it's becoming more and more clear that living with this virus living this virus means that we're masked when we do it. Now, just run my mouth a little bit there, but those were not my words that I just said. Those are not my words. Those are the words of Dr. Anthony Fauci, who's the director of National Institute of Allergy and Infectious Diseases. Those are the words of Senator Mitch McConnell of Kentucky. Those are the words of Prime Minister of Great Britain, Boris Johnson, the Prime Minister Angela Merkel of Germany, President Moon Jae-in of South Korea, the words of George Gao, who's the head of the Chinese Center for Disease Control, who had a long time experience dealing with response. And then finally, those last words are that of our current recommendations of the Centers for Disease Control here in the United States. So this is not a limited suggestion. It's becoming worldwide, and I'll end my comments on a letter that I think it's important that everyone hear. This is an open letter that maybe not everyone's read, but this is an open letter of over 100 scientists, leading scientists and leading economists, including 2 Nobel laureates that have signed on in not requesting, but urging governors of states and leaders of states to require masking as we reopen our economies. Because there's an urgent message that this critical new research indicates that people are most infectious in the initial period of infection when it is common to have few or no symptoms. Cloth masks, the kind that we're talking about today, obstruct a high portion of the droplets from the mouth and nose that spread the virus. Non-medical masks have been proven, and scientific studies have been effective at reducing the transmission of coronavirus. Again, this is not myth. This is an actual fact that cloth masks stop droplets that have virus in them. And so if you're infected and you have a mask, you're less likely to pass it to other people. The cloth masks that we would be wearing can be washed in soapy water and reused. In places and time periods where mask use is required or widespread have been shown to substantially lower community transmission. And that's the name of the game. As we get back up and running as an economy, we have to make sure that we can continue to do that, especially as we get through the summer, back into the fall, when weather's a little cooler and we're indoors again. We have to have started a culture of masking and being used to it. We have to learn how to live with this virus so we can keep our businesses open, keep our students in school, and keep our families safe while we're doing that. And so it's been shown that the masks are effective. And laws and government mandates have been shown across the board also to have a very dramatic impact on masking compliance. And that's really, at the end of the day, what this is all about. I mean, there are some people that may have pre-existing conditions that are comfortable wearing a mask. There may be people that for whatever reason are not rule followers, don't want to wear a mask, or some that maybe just don't know that it's the right thing to do at this point because of the conflicting messaging and the conflicting things out of the news media. What's not conflicting is the advice from the medical community. What's not conflicting is the advice from leading economists from MIT to Yale to all across the world. What's not conflicting is that our economy does not recover until people feel safe. And one of the most cost-effective things we can do to keep people safe is to increase masking compliance. And if we as a government can, and as an elected body, can help our population become more masked and reduce the transmission in the community, that's going to allow us to have a longer and deeper recovery and sooner. We acted soon initially with our shutdown. And I think it's been indicated that those numbers have saved lives. And now we have an opportunity to make sure that we carry forward those gains. The lockdown was the only item in the toolkit when we exercised it. Now we have more at our disposal, and masking's the cheapest. It's the most effective, with the least amount of money and the least amount of burden on everyone. So I would urge that today that our commission, consider recommending to our county manager, with the assistance of the health department and legal staff, to take care of our own house. Let's get Pitt County government in a place where everyone in our government, everyone that works for our government is masked, and everyone that transacts business with our government is masked. And that way that we're doing our part at showing what we all really should be doing in this moment together to protect each other, and that's wearing a mask. And let's start at home, and then let's turn after that over the next several weeks and let's work with our public, and let's work with our municipal partners at getting a strategy together to help a broad-based, it's really a cultural change to wear a mask when you go into a grocery store, or if you're shopping for clothing. But there are ways to do it, and other societies that are not comfortable and weren't comfortable doing it. I use myself included. I mean, I initially was weird putting on a mask, speaking to someone that maybe wasn't familiar to me, because thinking that maybe by me putting on the mask that they would feel like I was somehow afraid of them. In fact, it's the opposite. It's the act of putting on the mask that we are protecting those that come into close contact with us. That allows us to afford them protection in the event that we're sick and we don't know it. And that's a hard thing to change. It's a hard thing to change for me. It's a hard thing to change for everyone. So, this first step at making sure our local government is doing what it should to protect our employees and also those that are serviced by our employees. And then on the second prong of that, hopefully the next 2 weeks, come back with a plan with all of our municipalities to really get masking up in Pitt County, so that we can really get back to work and really continue down a path of economic prosperity and health.
I want to thank you very, very much, Commissioner Nunley, for that fine presentation. I think certainly masking has been echoed loudly by Dr. Silvernell, Dr. Waldron as well. So that is something to be well taken. I see Commissioner Ward hand first.
Yes, I would thank you for that, Chris. It was what I was trying to kind of get in and say. I was not able to write all 4 of the items that Dr. Waldron referred to. All of them are things that we now have in place, if I remember correctly. Number 4 being wear mask whenever social distancing is not available. And I would like to encourage, Chris, if you're going to make that as a motion, that we go to everybody encouraging it, then revisit it, but expecting our county employees and those of us to be an example and to wear a mask whenever we're out in public and with people. But let's not take away, let's still encourage in your motion that everyone else wear masks. And then we'll revisit it in 2 weeks and see where we are. Because I think if we wait 2 weeks and I'd like to see people wearing masks, and then we'll check again and see how that goes. I'll be glad to make the motion, but I would like, if you would prefer doing it, I'd like for you to add that.
Okay, and you've made a motion. I see Commissioner Florida Huggins hand. Commissioner Huggins.
Yes, thank you, Chairman McLaughlin. Chris, I just have a question. Where do we add businesses into this, requiring of mask wearing? And my reason for asking is because I went to a business on Friday of last week. This was a sandwich shop, and nobody in there was wearing a mask. I was the only person in there. The people serving the food did not have on a mask. So, and that may be, I don't know if that's a question for Dr. Silvernell, and especially Dr. Silvernell, maybe Dr. Waldron too, but especially Dr. Silvernell. Where do we address the businesses? When do we address the businesses, employees wearing masks?
So, Mr. Chair, if I could answer Commissioner Huggins' question, then maybe you can go to the other. Would that be okay?
Okay.
Just for clarification, Commissioner Floyd Huggins, it's really a 2-pronged requests today. The first one being that we take care of our own house first, that we take care of Pitt County government. And then as it applies to businesses and the general public, revisit that in 2 weeks' time, after we've had a chance to work with public information, with our health department and with our municipal partners, to hopefully come up with a plan whereby we can implement something with regards to businesses and members of the public. But not to do that today, to first take care of our own house, mandate it for Pitt County and anyone interacting with Pitt County, and then start working toward that. Because this is really about encouraging compliance, but making sure that we have the most amount of people complying. And if we do have a mandate, then it's been shown that most people are going to follow the rules. And this is not a gotcha measure. I mean, I don't expect that we're going to have, the masking police out there, but this is about saying, hey, this is what we're supposed to be doing. This is all what the scientists are saying to do. This is what leadership's doing, really, frankly, on both sides of the aisle. And so, but taking a little bit longer approach on that is putting it on the public, just to make sure that we have our own house taken care of, and that we do it in a way that at the end of the day gets the most amount of compliance, because that's the goal. It's not a gotcha measure, but really trying to, by the time we get out of the summer and back into the fall, that we've got most everyone wearing a mask, which is, I think, and put us in a much, I don't think, but public health experts think it puts us in a place where we can, the economy can continue to operate where we've been as far as phasing goes, and also keep our public much safer by keeping that infection ratio 1-to-1 below 1. If that answers your question, Commissioner Huggins.
Well, yeah, I understand what you're saying there, but then I have another concern, and this goes to again to Dr. Silvernail and Dr. Waldron. And I know they do not have control over all of the medical community because they're private docs offices, but there is a conflicting message out there about wearing a mask. Again, I was in an establishment on Thursday, and I overheard a customer saying to the salesperson, of course, the salesperson was wearing a mask. I was wearing a mask. This customer was not wearing a mask. And she said that her nursing friend, her friend who's a nurse, said that that wearing a mask is not necessary. It's not needed. So again, there's just mixed messages, messaging out there about wearing a mask, and even in the medical community. So I don't know how Dr. Waldron and Dr. Silvernail can address that, but somehow or another, and I know everybody will not ever wear a mask, but we have to say that wearing a mask is a way of stopping the spread. Even if you, as you said, you don't think you're sick, but you're protecting the other person.
Okay, thank you, Commissioner Huggins. Our manager, Scott, will have comments at this time, Scott.
Yes, so just wanted to address the question from Commissioner Floyd Huggins in terms of businesses. If on the second pronged approach of Commissioner Nunley, in terms of coming back in 2 weeks, we really would need all 10 municipalities in the county to join together. Because if you were to take action today for businesses, the far majority of all businesses are outside the jurisdiction of which you as a board of commissioners, or through the chairman, through the orders that he can write. We cannot enforce or hard ask anything within the municipal jurisdictions where the businesses are located. So we really would need to probably have a county-wide hard ask or encouragement on this. Otherwise, if the county just does it by itself, the far majority of all your big box retailers and your retailers, period, are outside jurisdiction, i.e. outside the municipal limits of one of the 10 municipalities.
Okay, very good. Commissioner Fitzpatrick.
Thank you, Mr. Chairman. I actually completely agree with Scott on this. My concern is that a lot of these municipalities are not going to take the same approach and implement these masking requirements. So I think much like what we did previously, where we put into place certain things and then other municipalities weren't following them, we're just going to create confusion. So unless everyone else is willing to sign on to this, I would be in opposition of it.
Thank you. Commissioner Colson.
Well, according to this thing on page 30 and 31, one of my concerns, it says that people would be required to wear a clean mask. Who polices clean? There's a lot of organizations out there, and I understand the World Health Organization is now saying that healthy people shouldn't wear masks because they're finding that there's problems associated with it. I would be for a public policy to suggest wearing a mask. And Dr. Silvanero, if you'll come forward, because I got a question for you. But I don't want to make it a mandatory, you have to wear a mask. That approaches the police state just a little bit too close for me. A suggestion to wear might be the right way of approaching it. And I don't think that would be out of harmony with what you suggested, Chris. Dr. Silvanero, as the public health director, your board has directed you to come up with a reopen plan. Last I questioned is you said that you would have that ready by our next meeting, which is Tuesday of next week, correct? Are you still on target for that?
Yes, sir.
I would assume that within there, you would have some statement about wearing masks and the benefits thereof as they may apply to various businesses throughout the community. And hopefully the community, besides just the jurisdiction of the county commissioners, would listen to the public health director. The fact that we do have a flat number of cases, it would seem to me that if what we're doing now is wrong, as far as not wearing masks all the time, requiring everybody to wear masks, the results of what we've done so far have actually been pretty good. And there are a number of people that do wear masks, depending upon where they go and what they do. There are certain stores, one of them, the Fresh Market comes to mind, is a requirement that you wear a mask. And so I believe that if people go to Fresh Market, they should wear a mask because that store is requiring it. But they're not saying you have to wear it outside. You don't have to wear it next door to the next business or whatever. But I would think that the public health director and your position on this would be important to receive before we actually go out and make some kind of a vote today as a commission to make it mandatory that people wear masks.
Well, certainly I support the wear, wait, and wash campaign as published by the North Carolina Department of Health and Human Services. We are allowing our staff to wear masks in the office as they see fit. Most of us in our own internal offices do not wear masks, but if we have to be within 6 feet of each other, people are wearing masks. The masking issue has been back and forth from you shouldn't do it to you should do it. Now some people are drifting back. As you said, there's some reports out that there may be harm to wearing masks. In general, the masking does reduce the transmission from you to someone else. It may offer some limited protection to you from an infected person as well. So I would be supportive of encouraging people to wear it. I'm a little reluctant to require the wearing of the mask because then you get into the enforcement issue, and it's almost unenforceable unless you are going to have local law enforcement ticketing people and writing citations for not wearing masks in public.
Gets to the police state that I'm kind of concerned about. The other day I went to a business and every person in the business was wearing a mask. They were wearing the mask over their mouth, but their nose was not covered. Every single one of them. So again, when you talk about wearing a mask, I believe we as a community or as a general health policy, we might say wear a mask and then show people the proper way of wearing it. I pointed out to them that they were not wearing the mask correctly. And of course, they didn't respond to me as a customer. They didn't want to turn me off and make me not ever come back again, I guess. So they didn't really say anything, but I did try to advise them. It was, they weren't wearing it properly. So what good is it if your nose is not covered? Is that true statement? Am I false?
Protective equipment doesn't protect if it's not worn properly.
Okay,
So I would
good.
agree
All right.
with that.
So just to restate it, as a public policy statement to wear it as a suggestion, a strong suggestion, I can support. Mandated, too close to the police state, I can't support. Thank you.
Thank you. Thank you very much. Before I get to the other commissioner, I'd like to hear a statement from our attorney in terms of what was stated as to where we are in terms of legality and mandated, or the suggestion that Chris Nunley proposed.
Yes, you're asking me is it legal to mandate it for county employees to wear masks?
Right.
Is that your question? Yes, it is legal to do so. So there can always be a policy, so long as it is supported on fact, to promote the health and well-being of your workforce. And so it would be appropriate if the county manager, who has a administrative policies and procedures manual, implemented a policy that required county employees to wear masks, for example, when they were serving the public or when they couldn't be when they couldn't maintain 6-foot social distancing. So the answer to the question is yes, it's legal. Is it legal to impose it upon the public? Yes, I think that you would do that through your proclamation or your state of emergency if you chose to do so. That is, other counties in North Carolina have done that already, and other states have done that as well. But I do think that you would, in order to achieve the greatest amount of effectiveness, take the time to work with your municipal partners, because that's where the bulk of your businesses are before you would do that.
Very good. Thank you for the explanation. I see hands, Commissioner Perkins-Williams and Commissioner Ward, and I see Commissioner Perkins-Williams.
Well, thank you, Mr. Chairman. I had my hand up at the Nunley start speaking, so I guess my sign doesn't show. Anyway, don't mind waiting till last. I want to, masking has been a pressure of mine from day one for a number of reasons within my family. And that's number one. I'm not willing to say that everybody must wear masks, because with day one when we started, I put my mask on when I heard about it before all of this. But the thing of it is, I think people enjoy defying the rules, because I've seen more people out where I go than I do with the mask than I do afterwards. Of course, I always have mine on and require that my family have it on. But I don't see us just going on with wearing a mask when everybody's been encouraging wear a mask and people are going to do what they want to. They're adults, or at least they wear the adult title. I like to, every now and then I may ask someone in the general public whom I do not know, say, do you think this is real? Do the COVID virus is real, or is it a hoax? And of course they say, no, it's not real. So then I can understand that. But what I want you to know is that we need to move on with this, or we'll be sitting here talking all day about wearing a mask or not wearing a mask. You're not going to make anybody wear a mask who doesn't want to wear it. We have other issues that we need to address, much more serious issues than this that I'm hearing and I'm getting, that I've gotten in my email since I've been on this call. And I am really concerned. And we should be more concerned about that when we are than wearing a mask. If they want to put on a mask, let them put it on. If they don't. Just don't walk up on me, and when I turn around and say, could you step back 6 feet? Then that shouldn't cause a problem. But if we say that now, it will cause a problem. So you never know what someone's issues are, but we have a serious problem here in Pitt County. So I'd like to see us move on, if you don't mind. I haven't spoken on this issue. I support wearing a mask. Somebody want to do that, but I don't want it required. Thank you.
Okay, Commissioner White.
Yes, sir. Thank you, Chair. And I would like to say that I agree with Commissioner Perkins-Williams, Commissioner Fitzpatrick, and Commissioner Colson. It is my understanding when I read this proposal, members of the general public are required to wear a clean face covering anytime they are or will be in contact with other people who are not in their household. And then it goes on to name different businesses such as grocery stores, pharmacies, places that the county doesn't have any control over. I am not in favor of mandating anything because we are not kings and dictators. Recommendations and suggested guidelines are one thing. And I would think that Dr. Silvernail's plan would be sufficient guidelines. And that's my comment.
Hey, were you asking Dr. Silvernail a question?
No, I was just suggesting that I agree with Commissioner Perkins-Williams that we move forward from this issue because in the proposal it is a mandate, and I think that when Dr. Silvernail gets his plan and his guideline in place next week, and when the Board of Health votes to approve that or not, I will think that that will be sufficient guidelines for our county.
Okay, thank you very much. Commissioner Ward, then Commissioner Nunley.
I would like to, I support exactly what Commissioner White said and most of the commissioners. I think I don't think that I said the word mandated. I'm looking at my notes that I wrote down here, and I don't have mandatory. All I want to say is exactly what Dr. Silvernail said, and I want us to just recommend to the citizens of Pitt County, we don't wait 2 weeks to tell them how important this is, but let's check on things in 2 weeks. I agree with that. But I think we as a group today need to recommend that people wear, number one, I think that was the number one thing Dr. Silvernail said, which meant to wear a mask when you are out with other people and when they are not distancing from you. You distance yourself away from them. You can't depend on them. You have to depend on yourself. Wear, wait, and watch. And I think that's what we should do. And I think it should just be a recommendation. That's all we can do. We're not going to go out and monitor it and arrest people and that sort of thing. And I don't think anyone had those feelings, Chris, or anyone else. But I do think it's important that we emphasize that if you have not been wearing a mask, when you're out among other people that you're not with every day, to consider it as very important in Pitt County. Thank you.
Thank you very much. Commissioner Nunley.
Thank you, Mr. Chair. And, wanted to respond to a couple of the, I guess, state policing comments. Similar arguments were made for, and these are of course permanent cultural changes in our society over the years, but when governments imposed the wearing of seatbelts to protect the public, when governments imposed wide-based motorcycle helmet laws, when the science indicated that people were dying because they were not wearing motorcycle helmets, that it was important. And of course, those are all individually infringements on your liberty when it's in fact your own health that you're risking by not doing these things. We're talking about a situation where by not wearing a mask during a global pandemic, you're putting other people at risk, not yourself, but other people. So we as a society, this is not police state. This is as a society, we do make these determinations. So I think that the whole police state argument is a little bit overblown. And frankly, when we're talking about coverings, body coverings, no shirt, no shoes, no service, that's not an unreasonable infringement of your freedom. And certainly with face coverings, we're not talking about a permanent mandate. But I'd like to, and based on I guess the end of the conversation here, it does seem to be maybe that my presentation was not clear enough. Really all that they ask today is that we as Pitt County government make the determination that this is the science behind mask wearing, that we as a government start doing it, and we mandate it for our own house, and that we come back in 2 weeks and then we see where we are as a community after working with our partners. I'm not asking today that we mandate it for the public. What I am asking is that we ask Scott to mandate it for our county, and based on science. That's our public health director's recommendation, that people wear masks. That's Dr. Waldron's recommendation, that wear masks. That's most major employers' recommendation, not a recommendation, mandate. Walmart. You know, we talk about the major employers in the United States have all moved here, and Pitt County government's one of the major employers in Pitt County. And so we need to show the public that we care about them. We need to show our employees that we care about them. And we need to take this step today. And I hope that a majority of the commission will see that this is a small step, initial step at getting to a place where we need to be. This is not a mandate to the public. This is about our own house, taking care of our own people, and doing what we can do to make sure that we can continue to operate. And I don't know if maybe Dr. Silvernail can answer this, but I think we can all answer this hypothetical. If you were sick and you're in a room with someone else and you don't know it, and you find out that you're sick, if you had been wearing a mask, you're going to feel better about that situation. Because again, it's not about you being protected. It's about you protecting others by wearing it. It's the considerate thing to do. So I would just ask that, you know, I would ask, and I would move that we direct Scott with the Public Health Department and legal to work up a policy for mandating Pitt County government have mandatory masking, much like major employers across the world, that we get in line with that, with those recommendations, and that we come back in 2 weeks and revisit anything else, but not have that on the table today, that we take care of our own house today. So I make that motion.
Okay. There was a motion made. Do we have a second to that motion? Commissioner Albright.
I had a comment. I'd be glad to second that, but I do think that to me, one of the most important parts of what we're talking about is that last paragraph on page 31. And I want to include in that the provision here that county staff work with municipal partners and bring back a report as to making masking requirements or suggestions or shoulds for the public in Pitt County's overall jurisdiction. I think this is about much more than the county offices. It's about a lot here is about engaging in our municipal partners in a conversation to see what we could do, and that would be part of what we hear about in 2 weeks also. That's my comment.
Scott, then we have Commissioner Colson.
Yes, Commissioner Albright, I think the Commissioner Nell is proposing this two-step process. The first step is dealing with the county offices and operations, and then step two to come back in 2 weeks after we've talked to the 10 municipalities and see if we can come together to ask for some type of encouragement community for masking. I did want to point out that we have amongst our workforce in Pitt County with 1,000 employees, we have a message to them. We have provided to them the opportunity for a face mask if they would so desire it. We have also asked all the departments to identify their conference rooms, their waiting rooms, auditoriums. We've got specific signage posted there saying what the occupancy limit is. I know in office building here, we have actually in our conference rooms designated where you would sit 6 feet apart from another person. And we posted on the doors too that if you can't accommodate that 6 feet apart, then everybody in that room is required to wear a mask. We've also have put up plexiglass shields. We've got signage for inline queue. If you're, say at the tax office paying a tax bill, that should be in place. We're also ordering, in the process of ordering a cloth mask that the employee can take home, one per employee, wash it daily as needed. But at this point, it's just, it hasn't been a requirement other than if you can't we have required that if you cannot maintain appropriate social distancing, then yes, you should be wearing a mask, but there's not a requirement. So this would change that from the board's directive to more of a requirement, if so voted on. And then I guess then the second question is, for that second step, is the board wanting to come back in 2 weeks with having had a discussion with my counterparts managers to see if the other jurisdictions, the other 10 municipalities are willing to join the county on some type of a recommendation or an urging of the public from a community-wide perspective all across Pitt County.
Okay, very good. Commissioner Coast?
Well, we may have got off a little bit on a little bit of a tangent there when we say it's not required. But if you go to page 30 and look at the third paragraph, it says, members of the general public are required to wear a clean face covering at any time they are or will be in contact with other people who are not household members in public or private spaces where it is not possible to maintain social distance. It says mandatory right here. So when I make my comment about it being mandatory, and then there's a retreat from that from other people, it makes me wonder why this statement was even put in here on page 30. It says mandatory. That scares me.
That was actually sample language from the Durham County.
It does not matter. It is in here as part of the statement. And I understand it's sample language from the Durham, but still, this is what we were to discuss or to consider. So I didn't just make up mandatory. I'm reading it right here.
Okay. Commissioner Ford Huggins?
Well, Mr. Chairman, I was going to, are you hearing me?
I can hear you.
Okay. I was going to second Chris' motion. And I don't know if he's willing to say required instead of mandatory, and remove the word clean masking, because I don't think we can dictate, to a person whether or not the mask is clean or not. And with Dr. Waldron's letter of recommendation of wearing masks, I'm very supportive of requiring our staff to wear the mask, and then to come back after meeting with other municipalities to see if we can initiate a countywide effort of wearing masks. As Chris said, other countries and states are moving toward requiring face masking. So that's my second in that, with those changes, if Chris will accept.
Thank you very much. Commissioner Nunley, did you hear that?
I did, and I was just going to say that I will, I think the language to require or whatever, Manager Elliott would see fit, just to make clear that really the picture that we all see on the screen right now, right, this is not an insult, but when we look across the world and we see legislative bodies meeting, countries that have low infections rate, all of their lawmakers are wearing masks when they're meeting in closed session indoors, and we are not. And I think that we need to move in that direction, and I hope that we have a majority that'll support this initial step, and then work with our partners to see what's going to be best, again, to get compliance highest. It's not a gotcha move when we're talking about the broad-based community. We want people to wear masks because it works, and it's going to keep us all. It's going to keep the economic recovery moving forward, and it's going to keep us all much safer as we enter fall and winter. So I'll accept that small language modification and hope that majority of the commission join me.
So the word clean is removed and the word required is substituted for the word
Mandated. Yeah, so this, Mr. Chairman, if I may, so the language that's in your agenda package is language in Durham County's state of emergency proclamation that requires mandating masks in the public. I understand that is not what we're doing today. What we're doing today, if I understand what's being said, is that we are going to, the motion is to require county employees in Pitt County government to wear masks and not to require that be a clean mask. So this language will have to be modified into the form of a policy, which is something that the county manager does all the time in drafting administrative policies. And so we could assure that in the drafting of that policy, the word mandate is not used and the word clean is not used.
And are we saying in terms of the operations for county offices that is this only when appropriate social distancing cannot be utilized, or is this at all times? Obviously, somebody who's by themselves in their office, I mean, reasonably thinking that you would not have a mask there. But if you're walking down the hall, I guess I'm trying to figure where the line is here on what is being asked or what the board is directing.
Okay. I think we've heard what's said. So in plain language, maybe we have to repeat that again. The motion then will be
to require county government employees to wear masks when, let me suggest, when they cannot maintain social distancing or when serving the public. And if I've mischaracterized that, I'd ask Chris Nunley his intent. And his hand is up.
okay. Commissioner Nunley?
Yeah, I think so. And so maybe Dr. Waldron can weigh in on this, but the real risk that we're talking about here and on the CDC recommendations and everything is that the social distancing indoors is not really an either or proposition, that when you are around other people and you're indoors, the recommendation is that you're wearing a face covering. So my motion would not, it essentially would change, again, what we're seeing on the screen today, where you all are at the dais and everyone's unmasked in a room, presumably with less than 10 people, and that you can safely, quote unquote, safely social distance. It's my understanding that the medical recommendation, medical community, is that when you're indoors or transacting business indoors, that the recommendation is masking when you're around other people. And so that would be what that was my intent, to really change that view and change that dynamic. But certainly when you're in your own office or when you're not interacting with other people, take it off. I mean, it's not it's kind of one of those deals that when you're not at risk at putting your droplets out into space, then, but maybe Dr. Waldron, you could clarify that, or Dr. Silvernail, or both.
Dr. Waldron left.
Dr. Waldron has left, but Dr. Silvernail is here, so. Dr. Silvernail.
Hello again, Commissioner. If I understand your question, if someone's working by themselves in their office, they could be unmasked. I would agree that is, if they're in their office with no one else in the room with them, they would not pose a risk to anyone and could be unmasked at that point. If people are within 6 feet of each other in the workplace, where there's the potential to exchange droplets, yes, masking would potentially play a role in stopping transmission amongst county employees, and certainly when our public facing services wearing a mask, if there's not some sort of barrier between the employee and the public, would also serve to decrease transmission in that aspect.
Thank you.
Okay. Commissioner Ward?
Chris, one thing, please think about this. It's not going to change anything that you have made in your motion, but I wonder if you would add that we continue the recommendation of our citizens to wear masks whenever in a group that is, that they are going to have to, that they cannot distance themselves from. Like when you go to the grocery store, or you go in an office, or you're walking down the street, and you're going to pass people. I think that you know, I don't want it to appear as if we're discouraging that. All I want to say is let's continue and encourage people to wear their mask when they're in public and when they may be closer than 8 feet.
Thank you, Commissioner Albright.
Yeah, I'm sorry, I'm getting a little confused here. I thought we were talking about a general public issue, and now it seems like we're talking about a county commissioner's employees issue. And I'd like some clarity as to what we're talking about. I don't understand why we would be communicating with our municipal partners if what we're talking about is simply a county employee issue. I'm sorry for being dense on this.
I think you're right.
Again, as I understand Commissioner Nunley's approach on this is, he wanted today, being June the 1st, just to bring up a approach for the Board of Commissioners to direct me as county manager of how to manage our workforce of 1,000 plus or minus, and then for me to then work with our municipalities over the next 2 weeks and come back on the next meeting on June 15th to then have the more countywide proposal that would include all the jurisdictions of the 10 municipalities if they're willing to participate, as well as our own jurisdiction of the unincorporated portions of which this could then affect. So again,
And if I may, I think that's what was intended in the last paragraph of the agenda packet on page 31.
Yes, I understand that, but I thought that, Janice, you were saying that as you were interpreting this, that it was only for Pitt County employees and
today.
What we're voting on. I'm trying to get clear on what we're voting on.
And that's how I understood it to be, that today the vote is only applicable. I'm just going to go back to your agenda item, that the Durham County language would be modified to apply to the operations of county government offices and operations, and that county staff would then be directed to work with municipal partners and bring back a report as to masking requirements for the public in Pitt County's overall jurisdiction and municipalities.
Thank you very much.
Okay. Now, a motion was made, and I think it was second. In that understanding, are we clear on the motion now?
No.
So as I understand the motion now, do you want me to take a stab at it?
Yes.
It still is only applicable to Pitt County government employees and Pitt County government offices. And as I understand it, it is to require a mask when indoors and interacting with other people.
Okay, Commissioner Fitzpatrick.
Thank you, Mr. Chair. I'd like to make a substitute motion that we table this until we have had an opportunity to discuss any kind of additional regulations that we would put on county employees with all of our fellow municipalities. And, you know, I think we need to apply the same logic and reason as we're not agreeing to other resolutions because they're too specific and would have local approaches. To me, this is even more extreme. So I would ask that, and quite frankly, I would ask Scott, as someone who manages all these employees, whether or not he thinks that's reasonable to have his employees do. But my motion would be to postpone the vote requiring county employees to have to wear masks.
I'll second that.
It has been moved and properly second as a substitute motion.
You did have a second from, just want to note, you did have a second from Commissioner White as well
Did have
before
a
that.
second for Commissioner White as well. Okay, so Madam Attorney.
You vote on the substitute motion first.
Okay. Would you read the substitute motion, Madam Clerk, and then we'll move to the original motion?
Motion to postpone the vote regarding policy for facial masking until a further date.
Okay, we'll move with the substitute motion made by Commissioner Fitzpatrick first. Madam Clerk.
Chairman McLaughlin.
Now, yes, it means that we support that. No means we do not support it.
Right. If you vote yes, then you are not making a decision on masking today. If you vote no, then you will consider what was proposed by Mr. Nunley.
No.
Vice Chairman Colson,
Yes to
I'm
postpone. no to-
confused, you know. Yes, yes, I'm supporting them. Yes.
Commissioner Albright,
No.
Commissioner Fitzpatrick,
Yes.
Commissioner Floyd Huggins,
No.
Commissioner Nunley,
No.
Commissioner Ward,
No.
Commissioner White,
Yes.
Commissioner Perkins Williams.
Commissioner Perkins
Commissioner-
Williams?
The yes means we take it off the table and no mean we don't.
Correct.
That's what
Yes.
happens to me when you discuss it a long time. Yes means what?
You delay,
No
you,
mean,
yes means you postpone the policy at this point in time.
yes.
Okay, your motion failed 5-4.
It failed.
Okay.
So the substitute motion failed, and so you'll now go on to Chris Nunley's original motion.
Okay. Do we vote on Chris Nunley's original motion now?
Yes.
Okay, the original motion by Chris Nunley. Madam Clerk?
Okay, Chairman McGlawhorn,
Yes.
Commissioner Colson,
No.
Commissioner Albright,
Yes.
Commissioner Fitzpatrick,
No.
Commissioner Floyd Huggins,
Yes.
Commissioner Nunley,
Yes.
Commissioner Ward,
Yes.
Commissioner White,
No.
Commissioner Perkins Williams,
Yes.
motion passes.
Thank you. At this time, we're going to take about a 5 minutes break.
Thank you.
And we'll resume after that. Thank you.
It's that one.
Thank you very much. We're back now. We're going to ask John Demery and Tim Corley to come.
Mr. Chairman, if we may do a roll call just when we resume from the break.
Very good. Roll call, please.
Chairman McGawhorn,
Here.
Vice Chairman Colson,
Here.
Commissioner Albright,
Here?
Commissioner Fitzpatrick,
Here.
Commissioner Floyd Huggins,
Here.
Commissioner Nunley,
Here.
Commissioner Ward,
Here.
Commissioner White,
Here.
Commissioner Perkins Williams,
Let's see where are we with this. I walked out, I'm just coming in. Are we off? We on what we doing?
Just say here.
Is it my time?
she's here.
I just walked back in the room and everybody was just sitting there. So I start talking. I said, maybe they can find out something. Where are we?
On the road.
Oh, is it my roll call? I'm here, y'all.
John.
Okay.
Chairman, board members of the board, thank you. I'd like to introduce Officer Mealy. He has been with our department a year and a half. Most of you know him. He used to work here. He is our litter control officer, and he's done great things in the year and a half he's here. He's quickly going to go and give you some pictures of some illegal dumping and what he's been doing. Yeah, we're inner over there.
Okay. Good morning, Mr. Chairman, members of the board, Mr. Elliott. It's going to be a short presentation. I just wanted to show you some of the challenges that we've been up against and what we've been doing to try to clean it up, and some of the steps that, you know, we've taken already. So with that, we got illegal dumping along roadways, landfills, which are illegal landfills I'm talking about, solid waste ordinance violations through citizen complaints, abandoned, burned, and vacant buildings, and Pitt County deputies' involvements. This one here is NC 43. This is right next to McGregor Downs Road where the Speedway is. I mean, this is just to show you how brazen they're getting. This was they just pull on the side and dumped it right on 43. I chased this one all the way through Edgecombe County and got them and found out that the owner of the company was Edgecombe, but the company was in Edgecombe County. The owner lived in Greenville, so I was able to go after him and I got him to clean it up. These here are just samples of some roadways. Saintsville Road, that's a major problem. Keel Road, that was a one-time deal. You could see a small package in there. I was able to identify the person for that. That was a child, one of their children that went to a dump. They got lazy. They threw it on the side of the road. The other one is Toll Road. That's starting to get to be a hot spot. I think that'll calm down because they're putting in a gas line through there and they're starting to build homes. And that's what we've been finding. Most of these roads that are rural and have no homes on it, they're using them as dumping grounds. Again, Saintsville Road again. Tucker Bullock, that was at the end, furthest most point north of the county. And that would, again, was a teenager, went to take out the trash for the father. I called him, I found the name, called the father. He was quite upset. Not only did he make him clean up that road, he made him, that area, he made him clean up a whole road. At least a half a mile long. So he paid the price on that one. This one here is on Alvin Road. This was a landfill. This guy was operating this just like we would any other landfill, a municipal landfill. He was dumping it and then bulldozing it, covering it with dirt and doing it again. He owned mobile home parks, and when he does renovations, that's where he would dump it. So got a hold of him, found out who it was, made him clean them all up. They actually did some digging to get some of the stuff that they were buried already, got him to dig all that out because you could see in the slide on the left, there's a slight incline. Slide on the right, see it's a little bit leveler because he cleaned everything. We had to dig it out. And now you see the dumpsters there and they stay there and he keeps them there and he removes them every 2 weeks. And I maintain that one. I'm over there quite a bit. But she's tried to do it again. This one here was another illegal landfill. This was like a communal landfill. This was off of Porter Road and 33 in Belvoir. It was an area that people, they all lived together. This was in the center of it, and that's where they were dumping all their trash. Here you have Northwest Acres. This one here, on that one on the left, that is pertaining to the solid waste ordinance. I believe it is section 8. Where it says that you have to have proper containers and it has to be removed every 7 days. Find a lot of this that a lot of people just throw it in their yard, they pile it up, and it's a mess. It's a vermin, mice, rats, snakes. So we take care of that. This other one here is on Warehouser Road. This was from a complaint. I rode by it. It was a burned down trailer. What you see there is a lot of insulation and stuff. And this was an older trailer. So I don't know if there might've been asbestos in there. There could have been a number of things. And this was blowing all over the road. So we got after this person, they cleaned it up. Beautiful area now. It's nice and clean. This here is on National Ave, which is right off NC 13. It's in a development. There are several homes that look like this that I've been working to get cleaned up. In fact, legal has helped me with one of these. And this one here is on Mills Road, just in from Mills Market. This was one of my first ones. This trailer, this owner here was using his lot, which was an abandoned trailer home, but he was using it for trash. Again, just dumping it and it just collected and is just making a mess. The one on the right is it completed. I had him clean everything up. And now as I ride by it, the trail is even gone. And now it's just a nice big old greenway. So it's a nice piece of property. This one here is on Mills Road going into Blackjack Simpson. This has been a problem here for a long time. I've worked on this one here and they did a great job cleaning this one up. And I believe now that they're doing some renovations on this trailer and they're going to probably re-rent it again, but the area is cleaned up. This here, I get a lot of these here calls, abandoned buildings. These I get calls from a lot of citizens. There's not much I can do with this because we do not have an ordinance on this. So there's nothing I can do. There's overgrown grass. Can't do anything about that. There is one thing that I do when there is overgrown grass, so I'd like to explain, is that if I see trash at the yard, that gives me an opportunity to go to them and say, look, you're going to have to cut your lawn also because I need to see that there's no trash within your yard. And that's one way of working around that. But other than that, I can't do anything with it. This here was in Farmville off of NC 121. This was an abandoned building that was demolished. They left all the debris there. And this pile of bricks that you see up in front were put there because they thought it was a dumping site because of the demolished building that was in the background. But now you can see they cleaned it up and those there little dumping sites are pretty much gone away. This here was on Alpine Road. This was one that legal helped me with. This was a foreclosure. Ditech was, I believe, the mortgage holder, and we got a hold of them and they took care of it. It took a couple of weeks, but they took care of it. This was a hazardous building, I call. This is on Sycamore Church Road. Believe it or not, with this house, there was a woman living in this house by herself. And I just couldn't do it. I couldn't go past it. I couldn't leave it. Even though the trash would have been, they did clean up the trash, but I had to go further and I had to get our inspection system, our health department involved in this here, inspections. And they went over there and they condemned it. And in fact, they had wire the main supply line from the pole going into the house. They're supposed to be attached to the outside of the house. Well, this house had it inside a hole in the wall attached to one of the rafters in the garage, in the attic. That is dangerous. And Greenville came right out and like within a half hour, cut the line and it was done. This is on Old River Road. This was another one that's, you could see it's just a mess. And I tried to get it condemned, but they wouldn't condemn it. I don't know what the reason was for, but it was just a mess. They did, however, since then clean everything up. Don't know what the condition of the trailer is now. This was a mobile home that was on East Hanrahan. They burnt it and they wanted to bury it. Well, I caught them before they got the hole filled and we were able to get all that one cleaned out, got a container, they took care of it. Now you can see on the right, it's just a nice little yard there. These here are abandoned buildings. The one on the left is Snowham Road off of West Hanrahan. That was on fire. That one I didn't do much with because the owner of that property knew who I was or knew of me, gave me a call and told me that he'll have that cleaned up within 2 weeks. But I just wanted to let you know that, you know, possibly knowing that, or Pitt County residents are starting to know that, you know what, we're taking trash more seriously. And you know, he got in touch with me before I got in touch with him. The one on the right was on National Ave, another just an abandoned home, and they just use it as dumping grounds. This one here, again, this falls under that Section 8 where the trash, and this was on Jackson Ave. They were just piling their trash in the yard. It's a vacant home, but I got in touch with the owner through Opus, and they came over and they cleaned it up. They said they weren't aware of any ordinances about that. The one on Mobley's Bridge Road, they were living there. They just piled up their trash. I got in touch with them personally and they took care of it. And that one there was an overgrown lawn. I used that same tactic. They cleaned it up and they started cutting their lawn. And they had a brand new 0-turn mower in the front yard. I didn't know why that wasn't being done. And then with the deputy involvement, what I did was I met with every shift at the sheriff's office. I gave a short presentation with them. And what they do is they help us with the Section 9 of the solid waste ordinance, which pertains to the unsecured and uncovered loads of their trailers or their pickup trucks. And what I've done was I've given them all solid waste citations that if they can see, or if they find somebody on the road with an uncovered load and it's spewing garbage all over the place, they have the ability now to pull them over and give them the Pitt County ordinance summonses. And with that, I'll entertain any questions.
Thank you very much. Now, let me ask you, when you find that these trash dumps on various sites, but you don't find an owner, you don't find anyone that was responsible, how do you handle that?
If there's no one, if they're abandoned homes you're talking about, like the ones that are vacant, I go through Opus and I'll look up the owners. And if I can't get in touch with them, if they don't have any identifying or contact information in that, I'll either go over to legal and meet with either Janice or Jordan, and we'll together get the owner's name and send them a letter. And normally they get back to us pretty quickly. Or I would go to the tax office, or I don't want to let you in on all my tricks and secrets, but I get them.
Yeah,
I work them. I mean, those are, I didn't get completed pictures of everything, but all those ones that you've seen that I've showed you here in this presentation, they are all done. They're all completed. So, I mean, they don't look like that anymore.
I'm thinking it's difficult to find those people that's on the side of roads that you dump.
That is the worst. I mean, to find single trash issues of people just throwing it out the, I don't think we're ever going to do anything to
How is that handled?
unless you witness it.
Who removes that?
Community programs or
DOT.
DOT.
Call
Well,
DOT
they do the
when
big
they
ones,
were, but DOT's backing off.
Up the highway too sometimes.
Yes.
yeah. But they do still handle the bulky items. The trash, they don't have the manpower anymore. I know they're getting ready for layoffs. So I don't know what's going to happen when they start cutting the lawns, the sides of the roads, the right of ways. If there's trash in there, that's going to be thrown all over the place, because they used to have a litter patrol that go out first. Not doing it anymore. I mean, they're still doing the primary roads, secondary roads, no.
And before COVID, we were working with the sheriff's department and taking inmates out.
And cleaning.
Okay.
Well, those are the programs that we run. In fact, short one was, there was this one call that it was up on Toll Road, and I found who the person was. She was a teacher, but it wasn't her, it was her son. And she was a little upset. So we set up an appointment for her to meet me there with her son, met me there, but the site was cleaned up because that's where they were building that pipeline, where they were doing that cut through. So they probably have heavy equipment. They just cleaned it up themselves and they took care of it. Well, she didn't like that answer. She wanted him to do something, right? So I said I would take him out and I would clean up roads or whatever. But what I was with especially with the younger people, I like to educate them. So him, I took out and spent a day just driving around the county, showing him what happens. He threw out 1 or 2 bags. That 1 or 2 bags can turn into that couple of those streets that you've seen there. And, and after that, this young man calls me almost every month, wants to come out with me again to do another street. We've done it once before. He wants to continue to do it. In fact, 2 weeks ago, he called me again and I said, with this COVID, it's going to be on hold for a while. But he's a PCC student. He wants to bring some of his other, students with him, and, we'll try to do some kind of community thing.
Good. So. Okay. Commissioner Perkawee.
Thank you, Mr. Demery and Mr. Maley. Did I say it right?
Yes, you did.
I asked for this presentation because most of you know I talk about trash every so often, and I've been talking about it ever since I've been on the board. This is something that communities can do for themselves. Now, our board wants development. We want companies to come here because when they come, that's job. But who wants to build a multi-million-dollar business or any kind of dollar business in a county that is full of trash? The one he didn't show you is the one that I every so often get calls on, right across from North Pitt School. So what? The hogs have been moved, the goats have been moved, but the trash, and I've seen the owner dump trash there. And we need some ordinances on this, Mr. Manager, Attorney Gallagher, because I go with students, with the youth of Northern Pitt County Improvement Association. We are interested in cleaning up. We can't get it done as long as you keep going against what we're trying to do here. It doesn't cost, just need people to do a little bit. Snakes are something that's dangerous to babies, and they are out here. You know, they're in people's houses and homes. And people call me a lot about the trash. They know that I'm compassionate about it. We are not going to move forward as a county as long as we keep allowing this trash to be a problem and a nuisance. I like to see if there's something we can do other than we can give Mealy some help, because he's getting the sheriff help now, and I appreciate that too, Sheriff Paula Dance, or whatever you can do about this problem. But it is a problem. And then when a house burns or something else happening, something else goes wrong, you can't just get it done. We want development over here. We need development in Northern Pitt County. This district deserves development. So I'm just pleading with you all to help with this in some way. The open trucks is a problem because the trash blows right in your windshield. So whatever we can do, I appreciate you, Mr. Demery, for allowing the tires to be dumped. I appreciate what you do for the mattresses along the roads, but until the community and the residents know that trash is a problem, I got beat up for not opening up the county because of trash is not the reason I didn't open. I didn't want to open it up because people refuse to wear masks, but the same term, the two together can cause health issues for people who have low immune systems. So please, I just want you all to know that this is a serious problem. It's a serious problem. And it's not going to get better until we all are interested in trash. I wish I knew where Hall Road is. Where is Hall Road? Tool Road. What was that one? That one looked bad.
Toll Road is between 43 and Worthington, down by D.H. Connolly.
Okay, all right. And see, they're going to come with a 4-lane coming through there from Craven County somewhere, I think. Well, when I go to New Bern, that's what I see. But is there something that we can do about this is my question, because you all have heard about it a lot. And I'm not going to go on and on about it. Lower your head, Beth. So I like to see us all taking interest in this. Would you please? Thank you. Can we get an ordinance a little more stronger?
We can look at our ordinance and see what we can do to make it stronger. Yes, ma'am.
Well, thank you, Mr. Demery. Appreciate that.
Commissioner Albright.
Yeah, I wanted to thank Sheriff Dance for being so aggressive in getting this program going and all the help. It's a wonderful report that you've given us, and I appreciate all the work you put into it. My question is, when you get someone to come clean up a site, is there an arrest or a citation involved?
There can be. That's officer discretion.
Okay.
And
what I'm trying to get at is, yeah, I think that you hit on one of the things here where people need to know more, to learn more about how aggressive the county has gotten with this. And if we could publicize the number of events that we're having, that it's possible to get out of this by cleaning up and not get a citation, anything that we could do to let the public know what a wonderful job you're doing and your officers are doing and bringing this to attention, I think would be terrific. But a news release or getting the Reflector interested in this issue would be very helpful in letting people know that we have this officer dedicated to this problem, and that he has taken upon himself and his department to further that interest with other officers. And again, I thank you and Sheriff Dance so much for this. My other question is about how if municipalities have no enforcement, that is no police, what kind of help does the county offer, such as your office, to those municipalities who are dealing with these sorts of issues within their own city limits or town limits?
The city of Greenville, we just call them, work with them. We'll work with the smaller municipalities if need be.
I mean, Greenville has police, but Fountain doesn't. So when we're dealing with someone who doesn't have a law enforcement presence, how does that work?
We have worked with some of the smaller municipalities. Grifton comes in mind. Fountain, I think, a number of years ago, we worked with them. So if they call us and ask, or where the
So if we have an illegal tire dump in someone's yard, the town could call you.
Yes, yes.
Thank you. Okay, thank you very much.
Commissioner Floyd Huggins.
I want to say thank you for the good job you're doing, sir. But did I understand you to say that we cannot do, or you cannot do anything about abandoned buildings?
That's correct. Not for solid waste, no, ma'am.
So is that something that maybe the county manager can answer? And Mary talked about ordinances. Is there an ordinance that we can develop that would take care of that?
I believe it's the reason because we don't have a minimum housing code. And Janice can correct me if I'm wrong on that.
We do have a county policy to deal with abandoned mobile homes that's administered through the planning department. It's not one that we administer through solid waste. Abandoned structures through the planning department. And it's an internal policy that requires collaboration and then ultimately may result in legal action to get a property cleaned up.
So these cases should be referred to the planning department about abandoned buildings?
Yes. And to the extent, we also work collaboratively with inspections. If there's a need, whenever we have a complaint about a property, we look at it from all of the different levels, and I have the pleasure of interacting with all of them. So when we have a complaint about a property, we will look to see if there's a solid waste violation. We'll look to see if there's something planning can do. I'll call out to Tim Corley to see if there's something from a safety perspective. If the building needs to be condemned, we will also look at the tax office and see if there are delinquent taxes. And if everything else fails, whether or not it's a property that might have issues in ownership or delinquent taxes that might make it appropriate for foreclosure as a benefit to the property.
Okay, thank you.
Okay, thank you. And thank you very much for your fine presentation.
Thank you.
Yes, sir. We'll move now to the manager's report.
Thank you, Mr. Chairman. On items A, B, and C, those all deal with your future meeting dates. And we thought in the month of June, we'd be at the Ag Center and we'd be in person. And that was prior to Governor Cooper releasing his phase 2 guidelines. And basically phase 2 guidelines for indoor groups is basically more than 10 people should not congregate inside. Technically, we're government. We don't necessarily have to comply with that, but we thought the optics on it didn't look good if we had a room full of people. So we wanted to continue the month of June via Zoom and try to limit the amount of people in one room to the best we could. Did want to just real quickly from last night, just show a little bit of property damage we had downtown. Got 2 pictures, both of the courthouse, one door that was sustained damage there on the left. That's the door to the historic Evans Street door, the historic courthouse entrance. And then you can see the flagpole there that's been actually, both of them are bent. One is bent more than the other one. Just we'll let you know about that, and we're making arrangements to take care of that. And Mr. Chairman, that's all I have.
Okay, very good. Item for consent. Oh, no, I'm sorry. That's the public.
That's correct.
Okay. Item for consent. Yeah. Commissioner Nunley?
I'd like to move that we approve the items for consent.
Okay. Commissioner Albright?
Second.
It's been moved and properly second. Madam Clerk?
Chairman McGawhorn,
Yes.
Vice Chairman Colson,
Yes.
Commissioner Albright,
Yes.
Commissioner Fitzpatrick,
Yes.
Commissioner Floyd Huggins,
Yes.
Commissioner Nunley,
Yes.
Commissioner Ward,
Yes.
Commissioner White,
Yes.
Commissioner Perkins Williams.
Yes.
Thank you very much. Item for decision now, we move to James Rowe.
Good afternoon, Mr. Chairman, members of the board. We're going to talk hazard mitigation a bit this morning. Several of you that have been on the board for a while have been through this planning effort previously. And just to remind you, as well as the viewing public, what exactly hazard mitigation is about, is actions to reduce or eliminate risk of disasters. And we'll talk about those disasters in just a minute, and to protect lives and property. This is vital. Of course, we've seen a number of natural disasters here locally over the past years, and it is important that we continue to plan against any risks that are associated with those. Why is it important? It comes down to being eligible for federal funding when some of these disasters hit, and make sure that we have public assistance available. So we're moving forward with that in the adoption of this plan. The current plan is set to sunset June 22nd. So it is important that we move forward with the adoption of this plan to stay in compliance with the state and federal guidelines. So just a little information about where we've been with our planning efforts. Not surprisingly, we've been with hazard mitigation planning since right after Hurricane Floyd. We actually had our first one developed in 2000. That was actually an award-winning plan. The county did get recognition from the state level. We were very successful in implementing several of those strategies. Onward from that, we did collaborate with several of our individual municipalities within the county. And then in 2010, we broadened that out, had several more local governments come in. The last two efforts, including the one we're speaking of today, have been a regional approach, and that includes 4 other counties beside Pitt County and 28 municipalities in total. So that plan, as I've mentioned, the 2005 or 2015 plan is set to sunset this month. And it is necessary that we move forward and look at what we've been developing over the last several months as our various local governments have pulled together in this planning process. Just to remind you of what other communities are involved with this besides Pitt County, we have Greene County in red shown, as well as Wayne, Lenoir, and Jones counties. So a little bit odd as far as the communities that we've been paired with, but these are all communities that are taking this planning effort very seriously. So our update process, we've been at it for well over about 12 months now. And this plan is a different type of process because of some issues with the virus situation we're contending with, delays at the state and federal level. These planning efforts have not been reviewed at the state and federal level yet, but to stay in compliance, our guidance has been that we need to move forward with our approval locally first, and then the state and federal guidelines and reviews will follow after that. So what are our main goals with this plan? Not surprisingly, to protect health, safety, and general welfare, reduce the risk and impact of future natural disasters. And as we've been privy to quite a number of times, especially after the flood recovery efforts, is to also pursue funding to help move properties, move people out of those high-risk areas. Some of the other main goals, expedite post-disaster reconstruction or recovery. We've been through that several times now. And educating our local constituents as to the importance of hazard mitigation. With this, we have a pretty structured type of plan that's required now with several different components that are required. And even here in Pitt County, all these hazards have to be analyzed. Certainly, we have some small dams that are here locally. In the national news, you've seen a lot of the dam failures of late, and those are still a risk here locally. Drought, we even have to deal with earthquakes. So all these types of natural disasters are mentioned in our plan. What are our strategies? As I mentioned in the abstract, we have some 20 that have been cited. Our comprehensive land use plan, the marriage between our comp plan and the hazard mitigation plan is vital. We try to reiterate some of our strategies within our land use plan to make sure some of these high-risk areas are not developed intensely. Coordinating with other community plans, such as that for ECU and Pitt Community College. Elevation certificates, one of our major disasters could be flooding, and typically is. So any of our elevation certificates have to be maintained for quite a long while. Seeking grant funding, moving on to emergency management. It's not just from the planning side of things. Certainly emergency management is involved with the continuity of operations plan, the emergency operations plan as well, the special medical needs registry. And a couple of new ones, I didn't include all the strategies, but a couple of the new ones, one that we've been harping on for quite a while is identify a location for and establish a new special medical needs shelter. And we're hoping to marry that possibly with the new gymnasium. And also a plan that's been developed by the state, the Hurricane Matthew Resilient Redevelopment Plan. That is also a strategy for us to continue to try to implement that plan as part of this. So with that, Mr. Chairman, our planning board has reviewed this at their meeting last month and has recommended approval. And we're requesting that the Board of Commissioners also move forward with approval today.
Thank you very much, Monroe. Commissioner Ward.
Yes, I would like to thank Mr. Rhodes and his staff. As usual, they've done a great job, but I would like to make a motion to approve the resolution adopting the Neuse River Basin Hazard Mitigation Plan.
Good. Commissioner Fitzpatrick.
I would like to second that.
Okay, that's been moved and properly second. Madam Clerk?
Chairman McLaughlin,
Yes.
Vice Chairman Colson,
Yes.
Commissioner Albright,
Yes.
Commissioner Fitzpatrick,
Yes.
Commissioner Floyd Huggins,
Yes.
Commissioner Nunley,
Yes.
Commissioner Ward,
Yes.
Commissioner White,
Yes.
Commissioner Perkins Williams,
Definitely.
motion passes.
Thank you very much.
Thank you, Mr. Chair.
Thank you. John Denbrick, now come up if you would on the convenience site operation.
Thank you, Mr. Chairman. At the February 17th, 2020 Board of Commissioners meeting, the board at the staff's recommendation voted to reject the bids received to operate the 14 convenience sites. Staff met with the two existing operators, Trust Denham Group and Management Support and Development. to negotiate new contracts. Trust Denham's new price to operate 5 sites will be $20,429.45 per month for a yearly cost of $245,153.40. Management Sport and Development's new price to operate 9 sites will be $36,773 per month for a yearly cost of $441,276. This price brings both companies in line the same dollar amount per site cost. The new contracts will be in effect from July 1st, and the county intends to rebid the operations of the convenience sites prior to next year. So there'll be a 1-year contract. The reason to rebid it is we're going to look to have just one site contractor to handle all 14 sites. Both companies have been, we sat down and met with them. They understand that these are 1-year contracts and that we're going to rebid it. That we're going to make sure that they are in compliance with the contracts. And if we see any problems that may impact their ability to bid. So what we would like today, what I'd like to do is authorize the county manager to execute these 2 contracts effective July 1st. I'll be glad to answer any questions.
Very good.
I got a question.
Commissioner Colson?
I didn't fully understand how you brought the sites in line with each other when one's being done at $20,429 and the other one's at $36,773.
Per site. The cost that it was costing us per site was different.
Why?
And back when we first bid this 2009, 2008, and it's always been a difference.
Is the one that's the higher amount, 36,773? Do they have more business and stuff? Is that
They have
part of the
9
reason?
sites. They operate 9 of the sites where the other company operates 5. So if you took
I
the total
understand that, but
numbers.
but isn't that 9 times 36,000?
No, sir.
No.
That's the total cost per month for those 9
For the
sites.
9
So if you
sites.
took that cost divided by 9, it would equal the other firm's cost if you
Okay, I
took it
follow you
divided by
now.
5.
Okay, all right.
I didn't mean, sorry if I confused you.
Very good.
It's a long day.
Commissioner Fitzpatrick?
Motion to approve.
Second.
It had been seconded by Commissioner Colson. Was that Commissioner Floyd Huggins? Was you gonna?
Well, I had a comment to make before it passed. I mean, motion was made. I just want to say to John, thank you for bringing the two companies together and offering the same amount of money for the same work. Because I did get a call on this, so I'm glad that you are doing this and you have informed the 2 companies of the 1-year contract, and that you will be looking to bid it out to one company after the 1-year contract. So thank you.
Yes, ma'am.
Okay. Commissioner Ward?
I was just going to make the motion. I'm ready to vote.
Thank you. Madam Clerk?
Chairman McGawhorn,
Yes.
Vice Chairman Colson,
Yes.
Commissioner Albright,
Yes.
Commissioner Fitzpatrick,
Yes.
Commissioner Floyd Huggins,
Yes.
Commissioner Nunley,
Yes.
Commissioner Ward,
Yes.
Commissioner White,
Yes.
Commissioner Perkins Williams.
Yes.
Motion passes.
Thank you very much. Thank you for your presentation. Now we have the CARES Act spending, Scott and Brian.
One more item before that, the number 3.
Okay, I'm sorry.
Award of Canadian
Award of,
Creek.
Creek the brief from PJ
I'll
Andrews.
be short and sweet.
Okay.
I came before you sometime back, about a month and a half ago, to let you know that the county had received some Hurricane Florence disaster money to clean out Canita Creek debris removal. Working with Janice and legal staff, which they've been wonderful to work with. We received bids on May the 14th. We are going to be starting at the Tar River, doing a 2.5 mile segment to the Bud Parker Road. And through the process, I'm looking for the board's recommendation to recommend Nixon Snagging and Clearing LLC to do this work.
Okay. Very good. Commissioner Ward.
I'd like to make a motion that we approve the contract to Nixon Snagging and Clearing LLC.
Very good. Commissioner Fitzpatrick.
I'll second that motion.
It has been moved and properly second. Madam Clerk.
Chairman McGawhorn,
Approved.
Vice Chairman Colson.
Yes.
Commissioner Albright,
Yes.
Commissioner Fitzpatrick,
Yes.
Commissioner Floyd Huggins,
Yes.
Commissioner Nunley,
Yes.
Commissioner Ward,
Yes.
Yes.
Commissioner Perkins Williams.
Yes.
Motion passes.
Thank you very much.
Thank you very much.
Thank you. CARES Act spending, Scott and Brian.
Yes, Mr. Chairman. So as a follow from the special call meeting, May 27th, we're bringing back to you a couple of different options to look at in terms of this federal CARES Act spending plan. As was mentioned earlier, we were initially told this was due today, June the 1st. The state has now changed that to June the 15th. And the other wrinkle in here, I think Brian's going to cover in a minute, deals with jurisdictions, counties, and local governments, cities seeking funding first through FEMA's PA Public Assistance Program. But with that, let me turn it over to Brian. He's got a PowerPoint here to kind of run through for you.
Good afternoon, Mr. Chairman. The rest of your board is kind of strange for a morning meeting to say good afternoon, but you say the best part for last because we're actually getting money. And I think what I will do differently is actually jump to the last slide in your, if you have your slides with you, to talk about the changes since we last met on the 27th. As the manager alluded to, the big change occurred with the due date, which was originally set for today, June the 1st. And now they've extended to June 15th. And they made the extension primarily because we got guidance down from the federal government that if there's an expense that qualifies both under the CARES Act and the FEMA PA, which is a public assistance avenue of funding, that they are recommending that we go through FEMA first to seek reimbursement on those eligible items before we use the CARES Act money. This logic is because we can leverage the federal government's FEMA money on top of the money that we get from the CARES Act. This would allow not only the county, but our municipal partners, anything that qualifies for that FEMA PA money, to go through FEMA first to seek reimbursement before looking at other avenues, in this case, the CARES Act funding. So this actually allows not just the county, but the cities the opportunity to look beyond what they've submitted and look beyond what we're actually looking to propose in the plan. I have been told that this pot of money is unlimited under the purview of the federal government, unlike the CARES Act, which is capped for, in our case, for $3 million. I've also been told that cities and counties should submit monthly. So in a normal event, you would wait for FEMA to close out the event because the event has come and gone, like in the case of a hurricane. But in this event, FEMA is recommending that we submit on a monthly basis. And anything that's not approved by FEMA or doesn't meet the FEMA guidelines then would fall back to the CARES Act. So I wanted to get that out of the way first and then jump back to what we originally presented back on May 27th. This is our original allocation of how the money was to be spent. You all directed us to look at several different avenues, and I'm going to switch to the second slide. If you have it in color, if you can see it on screen in color, the items in green are the changes, and the items in red are what was from the proposed list of funding. Also, we'll give you the caveat, as Andrew alluded to earlier, that anything that you all recommend today, we can change. We'll just need to submit that to the state and get their approval. So it's in stone somewhat so that we can submit our plan, but we do have that option to make adjustments just like we do with any other budgetary item. It's my understanding if we can get the plan in today that the state does cut checks on Thursday. So if not this Thursday, maybe next Thursday. So the sooner we get it in, I don't think it's going to take more than 2 weeks because I believe 56 counties have already received funding because they went ahead and submitted their plans in. So I think the state is looking to turn it around very quickly once the plans have been submitted. But I do want to point out on this first option, there are basically 3 major changes. Under the emergency employee leave, we zeroed that out. It was 10% of the funding, about $319,000. We changed the testing and testing supplies from 20% of our spending, which was roughly $68,000, to slightly over $1 million. And then the third change on the personnel costs that are for folks that are significantly dedicated to COVID-19, we reduced that from 6%, $191,000 to just 3%, $96,000. And then the second option that you have presented to you, basically the same change on the employee leave, we zeroed that out. On testing and testing supplies, we've increased that amount from 20% on the original proposal to 38%, which is $1.2 million roughly. On the personnel costs for employees significantly dedicated to COVID, it's still at the 3% instead of the 6%. And then on the contingency based, we reduced that from 25%, which was $780,000, to 20%, $638,000. And obviously this is for those unforeseen things that may pop up that would give us some latitude of funding if so choose that we needed it. So these are basically, you have the original from May 27th, you have option 1. The big difference being option 1 is testing at 33%. Option 2 puts testing at 38%. That being said, if there's any questions, I'll be glad to answer.
Okay, what you'd like to make, Scott?
No, I think Brian covered it pretty succinctly, and it's really a question whether you want to go with the 1.2 million in testing, $1,050,000 in testing, or $638,000 in testing, and then the other allocations, unless there's questions on those allocations. We really felt like on the emergency employee leave, we could apply for those monies, but we've already budgeted those monies, our staff monies, and all we'd be doing is putting the money back in the general fund. It made more sense to allocate it towards testing, something more tangible we could hold on to. We can hold on to those dollars in the general fund too, but this is more tangible as it relates to COVID-19.
Right. Commissioner Huggins.
Thank you. I would like to make a motion that we adopt option 2.
Thank you. Commissioner Nunley.
Second the motion.
Moving properly. Second.
Mr. Chairman, can I make one comment too? I was reached out to by one of our municipal partners who was concerned about the municipal allocation of $478,000 and kind of responded back the rationale for why we did what we did. And we then subsequently did a survey of our comparable counties, and also there was some listserv interaction on this topic. And Brian, can you summarize what you found on the survey?
So basically, we looked at our surrounding counties, and then we have a list of counties that you all saw earlier tonight or this morning when we compared our fund balance. We looked at our these are the counties that are similar in size to us, and basically what we found was across the board, each county was doing it slightly different. There were some counties that were looking at it from a sales tax allocation standpoint, and then other counties were basically looking at it from the standpoint that with the new guidance that the municipalities can go through FEMA first, and that most of the counties looked at it from the perspective of this is more of a county run issue
and that we assist the municipalities, and that they would look at their reimbursements. But across the board, there were hardly any counties that were assigning a reimbursement amount anywhere in the ballpark that the municipalities had asked for. And I specifically asked the counties to look at their county seats and their largest municipalities to see what requests they received compared to their allocation of the CARES Act. And overwhelmingly, most of the cities did not ask for anywhere in the ballpark of, I don't think there was a single municipality that asked for 50%. I think most were asking in the single digit percentages of what the CARES Act funding that the counties were receiving. So our allocation does look low compared to some of the requests that we have, but it does fall within line of what our comparable and surrounding counties were looking to allocate directly to municipalities. But we have said, and the guideline gives us the ability to take any of the municipal requests into consideration. And if they meet the guidelines, we can choose to fund or to reimburse them for those expenses.
Thank you.
Very good. I want to thank you, Brian and Scott, for the fine job that you've done in bringing this back to the commissioners. And certainly you did a great job in doing so. Commissioner Ward.
I was just going to second the motion or make it.
Okay, the move has been moved and properly second. Madam Clerk?
Chairman McGlaughlin,
Yes.
Vice Chairman Colson,
Yes.
Commissioner Albright,
Yes.
Commissioner Fitzpatrick,
Yes.
Commissioner Floyd Huggins,
Yes.
Commissioner Nunley,
Yes.
Commissioner Ward,
Yes.
Commissioner White,
No.
Commissioner Perkins Williams.
No.
Motion passes.
Great, thank you very much. We're now moving down to our commissioner's comment. Just want to start off by saying that we want to recognize a great man in this community, Dr. Sidney Locks, who passed during the weekend. And he was a Citizen of the Year for Pitt County. He was a former pastor of the Cornerstone Missionary Baptist Church, a former legislator for the state of North Carolina. And he's currently a member, he was a member, I'm sorry, of Mount Calvary Free Will Baptist Church, the church that I attend. And we'd like to pray for his family, his wife, and his wife Carolyn, and his entire family. There also was another legend of the community who also passed during the weekend, was Mr. Johnny Wooten. He was a musician, a musical genius, I call him. He did music at the former CML High School marching band, and he certainly was a legend in this community. As that you pray for his entire family.
Mr. Chairman, we also had the passing of Phil Dickerson this past week. He was the Deputy County Manager for Pitt County Government, Phil Dickerson.
He passed?
Yes.
I'm sorry. And I also want you to remember Phil Dickerson in passing this weekend. Thank you, Scott, for bringing that up. Okay, Madam Clerk. Just if you get there.
Vice Chairman Colson,
No comments.
Commissioner Albright,
No comment.
Commissioner Fitzpatrick,
No comment.
Commissioner Floyd Huggins,
Yes, I do have a comment. Mr. Chairman and other county commissioners, I want to publicly extend my condolences to the family of George Floyd. As you all know, my maiden name is Floyd. We're not related, as I have been able to establish that. I've talked to our fellow commissioner in Hope County, Alan Thomas, where George Floyd's sister lives, and the family is in so much pain because of everywhere they go, they see the video of this officer with his knee on George Floyd's neck. This is very hard. I don't ever recall such a tragedy as this that chokes me up every time I see it, and I have to turn away. And I just can't stand to watch it. But I want to ask for prayers again. Chairman said that at the very beginning, but I want to add my condolences to George Floyd family. He does have ties in North Carolina. So I want to encourage our citizens here in Pitt County to we want to celebrate his life, but we also want to do it in a safe manner. So I encourage all of our citizens to protest in an orderly manner and recognizing the uncalled for and such tragic death of George Floyd. Thank you.
Commissioner Nunneling?
Yes, thank you, Mr. Chair and Ms. Floyd Huggins. I will echo the sentiment, but as a white male American who was born and raised in Eastern North Carolina, I would also ask in this period of crisis that those of us that have been privileged to listen, not talk, but listen, respond and act, and let's do what needs to be done here locally on the ground and nationally, turn this story into something better.
Okay. Commissioner Ward?
Thank you. I do want to reach out to the Pitt County citizens who have been masking diligently during this time. I would like to encourage them to continue doing so when you're out in the public and closer than 8 to 10 feet of other people. Thank you again for doing that. And that's all.
Commissioner White?
No comment. No comment.
Commissioner Perkins Williams?
Thank you. I'd like to say something about Pastor Pay, who is the pastor of the United Methodist Church. I want to go on record of commending you for assisting our community and being the kind of spiritual leader you are for me. I wish you best on your next journey. I'm sorry we are losing you, but for me, to you, and for our district, visit us again. That's Pastor Pay at United Methodist Church in Bethel, North Carolina. Godspeed. Thank you.
Okay, very good. Entertain a motion for adjournment.
So moved.
Do you have a second? Commissioner Ward.
I second the motion for adjournment.
And now stand adjourned. Thank you.